we've certainly come to know her, at least my office and staff over the last year, bothering her on almost a daily basis, 7 days a week. And her being, I think she has 8 children, basically, with the 8 towns. We're the biggest and probably the loudest, but she has 7 others that she has to attend to, and she does a phenomenal job. This, we see it day in and day out. The amount of questions, not only from the towns, but from residents, from businesses, it's overwhelming. And she has worked really night and day to accommodate us all through this very difficult time. So I am very glad that she was gracious enough to accept this invitation in her busy schedule. And we just said really it would be an update, an overview to share both about testing, where we stand with the COVID in Connecticut, where the vaccination program is. And this, again, she's doing this in addition to all the other duties of the health department with opening restaurants and permits and whatnot and beauty salons. So we thank her for her work and the work of her incredible staff. She's also, Kash is going to give it at our next meeting an update on a very wonderful collaborative effort that we partnered with her and the North Central Health last Thursday at the Senior Center to accommodate about 152 people to get the vaccination in town. It was a very, very big success. We shared with you many thank yous from our residents, so we thank her for that. Hopefully we'll be doing some collaboration going forward. And with that, I give you Patrice Sulik, our Director of the North Central Health District.
First of all, welcome. And again, really we'll let you kind of just let it roll where you want to go, and then we'll open up for questions and anything you want to highlight. Because I know there's a ton going on. And again, even if it's not specific to Enfield, I know there's a lot of things going on in our surrounding towns as well. Again, just want to make sure you know that, really this is your time. We appreciate you being here. And again, good seeing you.
Thanks. Is it okay if I take off my mask?
Yes, you can.
I'll try not to
Excuse me, let me ask the health director.
I'm being respectful. So what I thought, and again, hello, everybody. Thanks for continuing all your public service during these very unusual times. And when Deb reached out to me to say, well, are you going to attend virtually or would you come in person? It just was such an exciting thought to come in person and be normal. Because I miss that. That's been one of the hardest things for me, not engaging in person with folks. So I'm really thrilled to be here, and I'm happy to accept, positive statements or constructive criticism, because we take it all in. We process it a little slower these days. Hopefully I'll be fairly coherent, and we'll try to continue to improve what we're doing. We use we call it the quality, not that we call it, but it's the quality improvement cycle. So we do something, we assess it, we hear from folks, and we try to keep tweaking the process. So we're convinced that by the time the pandemic is over, we'll have it all set and how to respond to a pandemic. And by the time there's another pandemic, I hope to be on
100 years from now.
On a beach somewhere. Well, yeah, then maybe not on a beach. So what I thought I would do is I broke it down to just different topics that I'll kind of go through fairly quickly, because I would imagine most of the conversation is going to relate to the vaccination process. But I don't want to take a lot of time because I really want to hear from you. My perspective gets to be like this, with nose to the grindstone. And anytime I talk with folks, I'm like, oh, I don't know that we were even actively thinking of this or that. So hoping we can have some good discussion. And if there's a burning question, just, interrupt me and we can deal with it then. So just a little bit of summary data that our epidemiologists grabbed for me. The population, as you know, of Enfield, a little less than 44,000. As of Valentine's Day, there were 2,785 cases, confirmed COVID cases in Enfield, and 43 deaths was what the data showed. An interesting point of fact, because we have institutions also within the town, and I know this has come up on more than one occasion, is approximately 18% of the cases happened in institutional settings. So they weren't, in fact, cases just out in the community. But that still leaves a good amount of cases out in the community. And of course, in my little tiny world, what we know is if we have a case number, that just means the people who went and got tested and got case confirmation. We know that there's other folks, and for a while when testing wasn't so readily available or encouraged, people were actually encouraged, stay at home. If you don't have serious underlying health conditions and you're doing okay, treat it like the flu. Stay home, take care of yourself, and try not to, overutilize medical services unless you really need to. So that's just a little bit of a summary on that. What I don't have that we're looking into is we weren't really clear on how many of the deaths occurred in institutions as opposed to out in the community. So I don't want to misspeak that. I know that we went through a period of time which was devastating for all of our towns, where we were losing those vulnerable elderly folks in long-term care facilities, but I don't want to misspeak about the numbers because I'm just not sure. So since the beginning of the pandemic, some of the tasks that the health department was involved in addition to, like Mayor referred to, in addition to the regular day-to-day work, which, by the way, did not slow down. And so if I had a nickel for every time I heard, I know there's a pandemic, but I really need my deck permit, I would be retired by now. So, regular life still has to go on in some way, even though there's a pandemic. So one of the things that we were really involved in doing is providing sector guidance. And, the state created sector guidance. We received that guidance, asked many, many questions for clarification on what seemed to us very vague guidance. At the same time, we were getting calls from those who rely on us, asking us to interpret or clarify. We tried to interpret it in the context of the regulations that we have, the state public, that document called the State Public Health Code. And we found out very quickly that those guidance was not made in the context of that. So that added to the confusion that all well-intentioned people working very hard in their own lanes, trying to move forward, there was a lot of confusion right from the beginning. We also received many questions from folks that we don't regulate and we don't have regulations for, which made things really challenging at the beginning to try to give them proper guidance. But providing that sector guidance was important. I think we probably rolled out half a dozen to 8 kind of tutorials or information packets to our food establishments, to our cosmetology salons. And every time it changes, we try to update that a little bit. Sometimes they find out before us, though, because they have professional organizations. So sometimes the local health department is the last to know. Another thing that we were tasked to do was respond to complaints. And just a little data fact I was able to gather, in less than a 5-month period, starting July 1 to about mid-November, we had 151 complaints from the public about people not adhering to mask use, mitigating strategies in food establishments and cosmetology salons. That's throughout our entire district, of course, not just in Enfield. And I want to be clear that while we have pretty strong regulatory programs for food service and cosmetology, we really joined in with everyone really feeling for the businesses and the dire circumstances they were under. And so we developed, especially at the beginning when all of the guidance was new for folks, we said, okay, we're going to call them. We don't do inspections by schedule, but we said we're going to call them. We're going to say, this is what we're hearing. How do you think you're doing? Why do you think the person complained about that? Is it only when management's around that people are really good about the masks? What is the struggles? And a lot of it was honest misunderstanding of what the guidance was. And most of the time, the folks really appreciated us calling on the phone. It was one less thing where they felt like kind of on the spot or trapped. And we said, listen, ask us for questions. Can we have a packet? Can we send you some more information? But we are going to kind of spot check, because we serve the public and they're concerned about it. And I think I've mentioned to one or two of you something that was almost comical, and that's that, someone driving by, a drive-through food facility and calling and saying, the person at the window didn't even have their mask on. Thank you very much. Did you say something to them about it? No, but they didn't have it on at all. Okay, well, we'll call them. We would give a call, and then invariably 2 days later, they call and say it about the same about the same facility. And I said, I have to tell you, you have a choice where you can spend your consumer dollars. Our work, even when we go in person, it is but a snapshot in time. We may see what you're talking about. We may not see it. We'll reinforce the message. But you, as a consumer that goes regularly to this place, you have so many choices. If you value the facility, I stopped going to a food place and I called them, not in these towns, but I called them and I said, gee, we really like to go there, and it doesn't seem like you're taking it seriously at all. And we really we're convinced that my husband and I are going to single-handedly keep all food establishments open. And that's not because I'm not trying to cook dinner. Honestly, that's my story. But customers have a lot of say right now. And I think that sometimes management feels like, oh, if I'm hardline about this, I'll push people away. Well, when the reality is, if they know how concerned their customers are, that kind of helps, emphasize the message that people feel the same. But I've talked to more than one person, and I'm like, do you have any other choice of where to get your coffee? Because if you really think they're not going to listen, then you can go somewhere else. But we're all creatures of habit. Okay, big use of time was responding to information requests from businesses and individuals. Businesses saying, we want to make people tell us, we want to test everybody before that was being done. Or how do we do this? Or how can we possibly do this? And then the other half was, well, Amazon had to shut down because they had a positive case. Why doesn't this big box store or that big box store have to shut down? Lots of misinformation. And I think it almost is divided by 50%. 50% of the people were angry that businesses were closed because they needed to be back to work. The other 50% that were working didn't think it was safe for them to be working, and they wanted a reason. Some actually asked me for notes. I want to know. And I said, I don't know what to tell you. I'm at work. Yeah. So it's a struggle if you have serious medical conditions, but it was like really a 50-50 break on what people wanted to do. And you heard real concern, real fear from some folks. Another thing we had to do right from the beginning is to track case reports on state databases. Then they went to a second database because I think we blew up the first database. It was never designed for a pandemic. And so 2 different electronic systems that don't always talk to each other, that was challenging. And then we were initially told not to contact trace, which means figure out who the case might have been exposed to. So we were not doing that. And then they changed their mind and said, you need to contact trace. So that required significant funding. We have some remote contact tracers we've had trained and that we're working with, that work with the state. And we also have some on-site contact tracers. And that brings me to talk a little bit about the funding. I think our initial disaster relief funding from the state only was approximately $53,000. We knew that wasn't going to go very far. And then when we started contact tracing, the health district was awarded, not competitive, just, based on population and number of cases, we were awarded for 30 months close to $1 million, approximately $362,000, and the last year is just a half year. And it came with a lot of requirements of what we had to do and enabled us, I would say, we have probably twice the staff that we have now, and it's a little frightening to think that it's still not enough. So we even had to put more workstations in the Enfield office, and we're pretty much a little hard to stay 6 feet away. But those resources have helped immeasurably in trying to tackle all of the work. So what else did we do? We worked very, very closely with our towns, all of our town partners, our library directors, our senior center directors, our recreation departments, all of our town leadership, and our school superintendents and the school nurses. And so last summer, trying to figure out what the schools were going to do, how was it going to possibly work, mask use in children, and it all seemed like an impossible task. And so many of us are on a first name basis that were not before. And then, as everybody knows, it's history now. Guess what? Most children don't have a problem wearing a mask. The adults, not quite as easy. The young they get used to things and they don't complain. So the school mitigation is probably the big happy surprise in the pandemic. Some unintended benefits, very little flu in the community, and I don't think we've heard yet of, not saying it's not happening at all, of the stomach bug going through a whole classroom or half of a school. We haven't heard of that at all. So one superintendent actually said, gee, I wonder if after we're done with the pandemic, maybe when we come back from Christmas vacation, we'll just have everybody wear their masks until February break, because it's really holding down. And it just really emphasizes that's the main way people are getting sick, from droplet, from people talking, sneezing, coughing, laughing, and a little bit of spitting. We hear about spitting sometimes. We also spent a lot of time with our daycare facilities. They went through a really hard time. Some just closed because they were fearful. And then the worry was, how will our healthcare workers, how will our first responders, how can they go to work if they don't have anywhere to leave their children? And what's worse, if they leave them with the grandparents, now we're really putting those grandparents, people that might be at a more fragile age, some of them, not all of us, but that was a big concern of where the children were going to go. Some daycare providers had a strong sense of responsibility to kind of keep the community going, and they stayed open as long as they could and finally had to close. So those daycare facilities talked to me. I think almost everybody has my agency cell phone number. And if we can nip something in the bud on a weeknight or on a Saturday or a Sunday, which prevents exposure come Monday morning, then that's what we do. I'm not sure everyone realizes, but we also had a role in the distribution of personal protective equipment to certain sectors of healthcare providers in the community. So it came through the regions. So we're mainly Demas Region 3, and then our town of Wyndham is in Demas Region 4. And so we received personal protective equipment, and we were tasked with getting it out to local urgent care facilities, private docs offices, dental offices. That was mainly what our task was. And I think at one point we had up to 26 different offices that were receiving personal protective equipment from us. And our staff, who was trying to stay away from everybody, said that was one of the most rewarding things that they were able to do. And people really, really embraced getting the PPE. Not enough N95s, our gloves, but lots and lots of gowns. I don't know what we're going to do with all of those. We still have some. So what else? So most of the rest of what I wanted to review relates to vaccine. So do people want to ask questions or?
Anyone want to ask questions before we get to the vaccines? So over the last, Councilor Riley. Sure. So then we'll go to let Patrice do vaccines. We'll ask questions on vaccines. Go right ahead, Councilor Riley.
Okay, so I wanted to get back to the school thing because I have two children that are in first grade and fourth grade. And I've been watching the news, and I've been reading a lot of articles from the CDC. And they've been saying that, transmission rates are low in K through 5 schools. And so it would be a good thing to get them back full time because those kids are the ones that really need it. And from personal experience, day after day, they need to go back. So I was wondering if you could share with us maybe the recommendations that you've given to our superintendent to let them go back on March 1st for 4 days?
So I'm happy to speak to that. So they've done a lot of research very quickly, and it's true exactly what you say, that children under the age of 10 don't spew, quite frankly, as far and as much as older children or adults do. And the data that they have shows that there's been overall not very much in-school transmission, especially from children. What we find, however, is that, I mean, we can talk about it if people want to, but the sports thing, which has such a value to kids' emotional well-being and their mental health, has been extraordinary. I think, we had probably more than 50 people quarantining because of sports, and there wasn't one yet person quarantining. And so we're in regular conversations. We talk to our superintendents multiple times a week, and we hear what they're struggling with. There's been different reasons for closing schools. Sometimes the schools have closed or gone virtual because of the amount of time they've needed to contact trace. Sometimes they've gone virtual because the amount of staff quarantining meant there was not enough staff to run the school. I do believe that most of our superintendents are serious about trying to move to as much in-person learning as they possibly can. And I think one of the challenges is that early in the school year, 15, a case rate of 15 over, 15 per 100,000 over a 14-day period, what they call the rolling average, was kind of the red zone. Like, consider going all virtual at that point in time. And now I think the last one, I wrote it down here somewhere. Bear with me. The current rolling average for Enfield is 28.9, almost twice what the red zone was. And so I think that there's a lot of factors at work. The state health department on their call with the State Department of Education, state health department, superintendents and other school staff, they keep saying there's very low in-school transmission, especially from students. However, it's a big burden, and then you have the other factor is that many school unions, many teacher unions are very actively, they have active concerns. I wouldn't minimize any of those concerns. And so there's a lot of different forces working. We encourage them on a case-to-case basis. And I know after the holidays, I mean, the case rates were just, the 29, that's lower than it was. We're waiting for the Super Bowl spike. But the cases are finally starting to come down because if you remember, they talked about it coming in waves. And so the second wave was higher and longer than we thought it would be. And so hopefully we're entering this decrease at the same time that we're starting to roll vaccine out, and things will stabilize to the point where our communities feel comfortable doing that. Does that answer your question?
Anyone else have any questions non-vaccine? Patrice, just kind of on the line, we chat about this a little bit. Has there been any thought, because again, we're already hearing about variances and things of that nature. And I know you laughed when I asked you this question, but I think part of this conversation is maybe we need to flip the switch on the school year. If the worst part of the year is late fall to early spring, when it comes to flu, whatever it may be, sneezing, coughing, I mean, everyone knows that the kids need to be in school. So why don't we start thinking of maybe flipping it for a few years if this is going to be, until we really do get a handle as a society on this, so kids are back in school.
Right.
And so I know it's not but it's funny. I think it's those things as we think about changing, when you say get back to the new normal, whatever it may be. Personally, I mean, I see it because I have a kid in high school.
Right.
I see the effect on her and her friends, and we're underestimating the mental health aspect of all this. And I'm not saying you, I'm saying as a society.
Right.
And so I'm okay with starting to think differently.
Right.
Maybe the school year shouldn't be September to June anymore. Maybe we flip the switch for a few years till there is a handle and we understand how this, mutates, how it doesn't mutate. I mean, and again, you can correct me if I'm wrong, because I still don't think, did we ever isolate the initial strain? And is someone, I've heard about the variations of this, but I've also heard, again, depends what you believe, that the actual initial strain we've never actually isolated to the fact of knowing truly what it is and from a scientific standpoint, I'm saying. Yeah, we certainly know the outcome, you know, but so just having said all that, it would be interesting to think if that's something as a health department of towns we start talking about, because I think we have to start thinking differently, because we're already hearing there's a variant here, there may be another, yeah, I mean, because that's always going to happen now, right?
Right, and the thing we heard, and it's really interesting to be at a time scientifically where, I mean, I've heard from some people, why is it taking so long to get a vaccine? And I'm like, this is incredibly fast. And then other people are like, oh, it's way too fast. I'm concerned about it. But the reality is that there's not necessarily an association that it's going to be lower in warm weather. And I think, you know, with what's going on in Florida, who I think a large part of that population doesn't believe that there's even a pandemic, and, you know, everything's open and so much more of life is going on as, you know, as it typically does. And so you bring up a good point, because I think things happened over this year that none of us would ever have imagined happening. And so I wouldn't say that anything is out of the question, because it's amazing, you know, creative minds are coming up with different solutions. And I guess I just keep hoping we can get enough vaccine into folks that, you know, that we start to develop that herd immunity. And I have heard about coronaviruses that they don't mutate as quickly as influenza mutates. And I've also heard that the Pfizer and Moderna vaccine are, you know, should be able to resist these strains as well. And, you know, if there's good news, the good news is that these strains aren't, you know, don't make people more sick, but they're more contagious. And given that everybody is really done with there being a pandemic, and some folks are getting cavalier if their families have remained unscathed, things like that, that they just, you know, they're like, we're fine, so we're going to be fine. And so it's kind of a bad time to kind of have everybody let down their guard. So
If you want to go right ahead into the vaccines, go right
Sure.
ahead. Yeah, thank you.
Sure. So the two major kinds of vaccine, and I'm sure you've all heard this a million times in the news, is the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine has a lot more challenging cold chain storage requirements, and so fortunately they're not distributing that to local health departments. We're receiving the Moderna vaccine. I think back, and I know I'm dating myself a bit now, but since 9/11, local public health departments were involved in preparedness planning, starting with smallpox, going more to anthrax and pills in people as a recent model. But in none of the smallpox models, or even when we had H1N1, which we kind of thought back in the day, we're like, phew, there was our pandemic. We survived it. Gee, that wasn't as bad as we thought. And then Dr. Matt Carter said, oh, no, that wasn't the pandemic. That was the dress rehearsal. There's a real pandemic will be coming. And he was correct, but none of our planning involved a 2-dose vaccine. Although after H1N1, our planning changed to realize that we're not going to set up, you know, as Nantucket was previously the big pod site in Enfield, and pod is just point of distribution. Anything with emergency preparedness has lots of acronyms. And it's not the model that we always train for, where we're going to get 700 million doses. We're going to line everybody up. If they're sick, we're going to pull them out of line and send them to the hospital. And we're going to stay there 24/7 for 10 days and get the whole population protected. After H1N1, we knew the reality would be is that that wouldn't likely happen because there wouldn't be enough vaccine. And of course, that's exactly what happened. We never could have anticipated doing 2 doses, which literally doubles the work involved to get vaccine into folks. And we never could have anticipated a scenario, although it seems so obvious now, that we would have to keep folks socially distant during that monitoring period. we really didn't monitor folks after we gave them H1N1 vaccine. We just sent them on their merry way. It wasn't so different for a flu vaccine. If we had someone that had flu vaccine reactions or some serious allergies in the past, we would monitor them, but it was, less than 5 people a clinic. And now we have to monitor everybody. Not all providers are monitoring folks. And we heard of one school nurse who didn't get vaccinated with us, driving home had a fairly serious reaction. And so we didn't want to shortcut any of that, even though we have not had much happening, thank goodness. And when folks respond, it triggers their immune system after the second dose. We kind of know what that looks like for most people, and we could, give them some information in advance what to expect. So we have Moderna vaccine. We received our first shipment the day before Christmas. It really seemed like a momentous event, but it was just this little, tiny thing, and we all stared at it for 10 minutes. Some folks, some health districts have had their vaccinating teams, core team, for several years. Some of them have had the same core people for 20 years. I had my team for a month. Thank goodness the board voted to have a nursing position put in place a few years ago, or I can't even imagine how more behind we would be. Given the fact they've been together for a month, they've really ratcheted up, streamlined the process. We had to deal with that situation called VAMS. You may have heard about it. It's very challenging. And we worked to streamline the process, and we worked to take computers and the VAMS piece out of the vaccination stations so we could continually increase throughput. And so today, they were in Stafford, and in about 5 hours, did about 165 vaccines. We also added MRC volunteers, that's Medical Reserve Corps volunteers. We're getting paramedics, EMTs, physician's assistants, physicians, dentists. It's just amazing. And most of them work full time, and they still come. And we have a couple of people who have come back already 3 times to assist us. So now we're getting close to the point where we can split off and do 2 sets of clinics on any given day. And provided we continue to have vaccine, which is also very iffy, we will be able to continually increase our output to the community. With that said, we're not the vaccinator of last resort. We're not the vaccinator of first resort. We're one of many partners who are going to vaccinate or are already vaccinating. We have some private providers. We have CVS and Walgreens, which are the care partners. Some other pharmacies are going to be getting vaccine, and we know our Walmarts in our communities are also vaccinating people. And so it's not any kind of competition, and of course our hospitals are vaccinating folks. Everybody has had their share of hiccups as they've moved forward to vaccinate people. And but it's getting streamlined now. I think the real remaining issue is having an adequate supply of vaccine to keep up with the capacity that we have developed. Lessons learned from all of our partners. Lots of encouragement for some of our partners. We were permitted to vaccinate school nurses with phase 1A as healthcare workers because they have to stay right in the room if a student or staff member gets, probably more so for a student, a staff member could just leave on their own, and they have to stay right in the room with them. And so that, across the board, all of our public school systems have said, when you have vaccine to vaccinate school staff, and some have even said they'll do the same thing when we can vaccinate municipal staff. And they'll just do the high school gym. We'll bring one vaccine coordinator from our office with expertise and the vaccine, and our nurse already has training for the school nurses, and they're just ready to jump right in and vaccinate. So that's been a huge encouragement. So I keep telling the state, as soon as you flip that switch, I need 6,000 doses right away so we can get that vaccine out into people. It's kind of funny, people want it to be first, And I kept saying, it's not always so good to be first. That's where there's we troubleshoot when you're first. Now they all want to switch to a Friday so that after the second dose, when people don't feel well, they'll be at home. And I said, well, everybody can't go Friday unless you want to wait 9 weeks. So we'll figure it out when we get to that point. But that's been people coming around to work with us. The call centers that some of the towns have come together and sorted out. We're just navigating our way, learning as we go. It truly is flying the airplane while you're building the airplane. The stressful piece is trying to go fast enough to make people happy or get them vaccinated, but there's that risk of going fast enough. I feel like there's disconnects. We're missing little things. What are we missing? And so I know we're not as fast as some providers, but we want to move forward in a way that's sustainable, and we don't want to make big errors while we're doing this. So it's a bit stressful, but it's also really, really rewarding to see the folks come in and get their vaccine and feel like they're getting protected. So, I'm sure people have questions or comments
So
about
we'll,
vaccine.
Councilor Ungar, then Councilor Muller, Councilor Bosco, and Councilor Riley.
Hi, thanks for being here. I have a question. The people that have the convalescent plasma, what is your opinion on them just bypassing the vaccine?
I wouldn't feel comfortable answering that question because I kind of pretend to be a nurse sometimes, but I'm not a nurse. And so I'm happy, we work with a few doctors. I'm happy to get that answer for you. And then I'll know the answer as well. But I do not know.
All set, Laura? Yeah. Councilor Muller.
Hi, Patrice. Thank you. What are some of the biggest challenges you're facing?
I think thank you for that question. I think the biggest challenge that we face is that we've signed a written agreement with the state in order to be permitted to order vaccine. We had to go through many steps of credentialing in order to do so. And that signed agreement, which was emphasized by a memo from the Commissioner of Health to all local health directors, and you probably all are aware of this, but the Board of Health hires me, but the Board of Health does not confer authority on me. Any authority I have is only as an agent of the commissioner. That's a different relationship than the Commissioner of Health has with a hospital or with a private provider. That means instantly it's a direct line to stop me if I'm not doing things the right way. And that involves turning people away that aren't eligible at the clinics. It puts our staff in a really rough position. Nobody's comfortable with it. Some people have been given wording where they believe they have. Some people believe if they get through the VAM system and the VAM system invites them to make an appointment, that it means that they are eligible. So some of this is done in innocence, truly. There's been a lot of innocent errors, but some of it is done because people kind of have figured out kind of a way to navigate around the system. For any of Connecticut towns that are on state borders, it's been a particular problem. So our colleagues to the east are having to turn away folks from Rhode Island. We're getting folks from Massachusetts who will say all manner of things. Our colleagues down in Stamford and Greenwich are getting folks from New York coming across state lines. And it's a terrible it's a terrible thing to tell someone, you're not eligible, and they'll say, but I do this and I do this, and what's going to happen if I can't do this? And the bottom line is that once I go on that slippery slope, if I'm going to make an exception for one, I really have to make an exception for everyone. There's not enough vaccine to make an exception for everyone. And so then I would be not vaccinating the group we're supposed to vaccinate. And it all goes into, a database, so it's traceable. And the only real tool that the state has given us is to have folks sign an attestation that they're eligible, which does not dissuade anybody. So I would say that's the thing that's the most challenging for staff. They're working really hard, and they're taking a little bit of abuse. So.
Yeah, and one of the things we talked about during our meeting was sometimes you don't get the list till the morning. So you can't notify them ahead of time
Right.
that they're going to be cut until they're already in line and waited.
Right. And we've tried to put out a little bit of messaging. We need to definitely improve it. We need to take some of our vaccinator resources and redirect them to doing more messaging. But even our colleagues who are doing more messaging, they're seeing the same thing. Something else you might not realize is that this is a federal resource, and once it enters the state of Connecticut and the state of Connecticut tells us who's eligible, we do not have the right, and it was stated to us very clearly, we all wrote it down, we do not have the right to turn away anybody, let's say, that's not in our member towns. So if you're eligible and you're in Connecticut, we can't turn you away. So what we've done to adhere to that and honor it, as well as take care of our populations, is when we're working like with our senior centers and with our town leadership to do clinics throughout the district and in summers, because we're responsible for summers as well, is that we've adopted a hybrid approach that we think nobody could take issue with. And that is whoever we're working with, say at the Stafford, in Stafford, we said, split the appointments. We're going to give you paper with appointments on them, and you can fill 80 of them or 100 of them. And then we're going to take the rest of the appointments and we're going to open them on VAMs. And so, we don't want anything to get in the way of our ability to continue to order vaccine. So, thank you.
Councilor Bosco.
Actually, I have a multi-pronged question. First off, who exactly at this point now is eligible for vaccines? And out of the people that have been getting the vaccines, side effects, what's the percentage of side effects, and what normally is a side effects for people that are just scared to go because they don't want to get the side effects? And then the second shift, if people get side effects on the first one, do they normally get side effects on the second one?
Good question. I'm writing these down.
Now you're talking to someone that's scared of needles. So, it's...
Yes. So first of all, I can tell you, I'm total needle phobic. And so I embarrass myself every year when I get my flu shot.
When I go to give blood, I cry and scream like a little girl.
Yes.
So
Yes.
they have to put me in the back, and they close the doors, and oh yeah, I'm petrified of needles.
Sometimes they have to make me lay down, and I say, well, are you using a small needle? Are you using a real tiny needle? I don't really know if they are or not, but they always tell me I am. And then they're rolling their eyes behind my back. So this is what I want you to think, because this is what I did. Your fear of needles is one thing. Your fear of the vaccine, if you're afraid of the vaccine itself, we can talk about that in a separate way. So separate the two so that they're two more manageable.
Well,
shots.
my biggest thing is that it's the fear of the vaccine. You hear, they have rumors that it has microchips in it. There's anything and everything that they are saying or was there. And a lot of people are afraid to take it. And then I know also people that are afraid because they don't want the side effects.
Right.
So, is it really the side effects? Is it really a bigger deal? Because I know two people that took it and they had pretty bad side effects. So is it more common than not? Then I guess that's where I...
So let's talk about that. And I think I can answer everything except what is the percentage of folks that have side effects, but I can give you some anecdotal information. So who is currently eligible for the vaccine, unless there's a press conference happening now that I'm missing because things change quickly, is 1A eligible were healthcare workers and medical first responders. And I think what happens is on the state level, when they're making decisions, the state isn't implementing. Implementation happens on a local level. So what makes sense when you're sitting around a table creating a list and it sounds clear, once you send it down to the local level, it's really unclear, and we need a lot more clarification. And so, believe it or not, healthcare workers also include funeral home workers, because they deal with the remains of people that could be infectious. And so there's a chart, and I can dig it up. I'll email it to someone here that can distribute it to everyone. But I don't know why it's not clearly posted on the state website. It clearly lists the different sectors of healthcare workers that were eligible under 1A. Medical first responders presented a few challenges as well, because we've always thought about it as first responders being first responders, and it had to get clarified many times. Only those who could get called out to a medical call would be considered medical first responders. That's phase 1A. Phase 1B contains an extraordinary number of different sectors, really almost the whole population. And I think it was a problem to just call it 1B instead of calling it 1B, 1C, 1D, 1E, because that has been very confusing. We were told we were going to be able to vaccinate school staff. We were getting ready to do that. We had and still have a great plan to do that when we're able to. And we were also told that local health departments weren't going to focus on senior citizens, that the state was going to assign that to other care partners. And then very quickly, in the span of a few days, that turned around. So in phase 1B, eligible folks are residents and staff of long-term care facilities, those 75 and older, and those 65 and older. And then there's a category, and I can send this list as well, that semi-defines congregate folks in congregate housing, which, is some halfway houses, homeless shelters, correctional facilities, and a number of other things. But I have had a question up to the state since Tuesday for clarification on that, because they've come to Enfield and vaccinated congregate housing staff and residents, and they didn't even tell us they were coming to our community. So before we go make plans to vaccinate others, let's say in one town there's 6 different places. If the state's planning to send a care partner to the first 3, I don't want to plan and go out and do those first 3 and have them say, oh, she's all set, we're going to go over here. No, I want to do 4, 5, and 6 and let them do 1, 2, and 3 so that we're fully covered more quickly. And so those are the folks that are covered. Frontline essential workers that are really, really, really essential and really frontline are not yet eligible to receive vaccine.
And what about people with health conditions?
People with health conditions, that has not ratcheted up. We wondered if that would happen with the 65 and older, because that's a question we get asked probably more than any other question. But that isn't a part of it at this point in time.
Thank you.
You want me to?
If you could figure out.
Yeah, I can say a little more. Our general sense, though, it's interesting, our general sense is that people are chomping at the bit to get vaccinated. And there's only a few different areas where we're still hearing about reluctance. And the problem is we all get affected if people do not want to get vaccinated, because in order to get to that level of herd immunity, since this is a novel virus, enough people really do have to get vaccinated. As far as side effects, I do not know the percentage. What I know, and I know more about Moderna than I do Pfizer, because that's what we're working with, is that it's less likely after the first vaccination. And after the second vaccination, it's not uncommon to have some flu-like symptoms. The vaccine is not live or dead virus. It's messenger RNA, bless you, that goes into your cells and tricks your cells into thinking that they've already had COVID. I've heard some talk that if people have had COVID and then they get vaccinated, they could have more of a reaction to the first dose of the vaccine. I would say the folks in our office that have been vaccinated, it's been from nothing at all to one person was, down and out for 2 days, feeling like she had the flu, and even called on a Sunday night and said, I just can't imagine that I'll be there tomorrow. And then she called a couple hours, she's like, oh, it's just leaving me. And that's kind of what people have said. But there's a whole range. If people get some side effects the first time, then they tend not to. It's not such a bad thing. It means it's working. But of course, nobody willingly wants to walk out on that plank of fever, chills, body aches, that sort of thing. So I hope that answers your question.
Thank you.
Okay.
Councilor Crisati.
Yeah, thank you, Patrice, for giving us all this information and everything. I guess I have a question about your coordination that you have with the state of Connecticut and through VAMS and all these clinics that are being set up. And I know it's probably very, very confusing, but in terms of your role, are you being designated from the state of Connecticut where you can set these clinics up, or are municipalities coming to you to say that we would like these clinics to be set up in our town and at specific areas, and are you coordinating with the state in regard to that? I'm just a little confused as to how, for example, if there's a clinic in Enfield, all right, and then, X number of residents from Enfield maybe get into the clinic while some residents have to go to Ellington, or if they have to go to Stafford, to Johnson, or I've known people who've gone to Preston, Connecticut to get there, or to Rensselaer Field. Is there priorities?
That's a good question. So the state does not tell the health district where to have their clinics. And that brings up a good point about how we're doing our vaccinating. We felt pretty strongly that for that age of the population that we're currently tasked to focus on, that bringing those resources closer to where they live would be a benefit. Many have issues with transportation and things like that. And then, if they're anxious, there's a comfort level of going somewhere in your own town. However, the original emergency preparedness plan for any sort of response to public health emergency for North Central was to have 3 major pod sites in our 3 largest towns. The first would be Enfield, and the towns in our district closer to Enfield would also be a part of that pod. The second site would be the town of Vernon, and then the certain towns that are closer would go there. And then Wyndham, which is the one town that's geographically separate from us, would kind of, that exists kind of on an island of its own and would have its own pod. So our plan that we're using like community centers, or in some of our towns, senior centers. By the way, Enfield has a beautiful senior center. One of our staff was trying to see if she could have her wedding there. It's kind of comical, but it really is a nice wedding venue. And so we wanted to go and bring the resources closer. But I will tell you, as we go to these sites, some of the town sites are not big enough to warrant us kind of losing a whole day, packing up, bringing everything there, setting up, closing down, bringing everything back to do it again the next day. Our throughput, the amount of people we can do in a day, is too much now for it. So if we can only do a portion of a day, it's not the best way, big picture thinking, to get vaccine into the community. But we think with this population, there's a value to it. Now, when we go down to the next piece of the population, which we imagine, although we really have no idea, we imagine that will be the school staff and municipal employees. We'll do those in a very different way. We'll go right on site. There'll be lots of coordination. And again, we have the beauty of that is we have all those wonderful school nurses that can assist us. And if the school nurses can't also be tasked to vaccinate the municipal employees, now we have a whole cadre of those MRC volunteers, and we can make really pretty quick work of that. That will be, it's kind of the most captive audience, if you will, and we can get through those. The schools all have a high school gym that's a good size to do that in. And hopefully, those smaller private schools will have separate plans for that. We'll attach them to one of our other bigger clinics we're doing. We already have a care partner that will work like with Suffield Academy. We're keeping an eye on the different schools that aren't public school systems in our district. However, for the next segment of the population, nothing's been officially decided, but we believe that what's going to be most efficient is to have, kind of for us, a major pod site in our 3 main towns, which was the original plan, and have a site, like for instance, the Enfield Senior Center, we could push through 500 people a day. There's just enough capacity, there's enough parking to do that. Could maybe even get up to 600 people a day. And so all this going to each town, which has a lot of value, and, none of our towns want to feel like they're less important, and hopefully they don't feel like they're less important, but we lose those travel resources and we lose a day doing like 2/3 of what we really could do. And many of us, and there's folks with the town of Enfield, and Chris could speak to, sorry, I have my back to you, Chris, is that what we're also trying to do is work with the state and other providers to set up potential what the state is calling megapods. Similar to what they did with the testing, where they set up some regular sites that were put in place. This is a little bit different, but we're working with our larger towns to say, hey, is there a space? Is there a vendor who's a provider that would be willing to take the space and do separate things? And then we're involved in the planning, but our thought was that the state would be providing them with a large volume of vaccine. We're talking that 500 doses a day would be the low end of what that would be. So looking somewhere to go with like 1,000 doses a day, possibly 7 days a week, when there's enough vaccine. Those plans seem to be a little bit moving forward slowly. I believe it's because there's not enough vaccine to really push them forward.
Correct.
But even if we get those here, we'll still be doing vaccine. And then when there's really a supply like that in the community, we feel like we have the resources and the relationships where we need to ferret out those pieces of the population that maybe aren't so obvious. I mean, there's homeless folks that aren't just going to come and line up. There's undocumented.
Right.
There's all manner of things. There's folks that maybe have low literacy and they kind of really keep to themselves. I mean, we're mainly English speaking, a portion of Spanish speaking, but there's some really smaller language groups in there. So we'll be working with their churches, houses of worship, to saying how could we get messaging out here and there, and that will involve us doing really inefficient clinics, if you will. To kind of reach those groups. It's going to be a very low bang for the buck, but we see that as when we have other real providers in the community, we see that as a really, really good role for us to take on when we can.
Yeah. Well, thank you. That clarifies quite a bit in terms of the communication that you have to do. And so keep up the very difficult task that you do have, and just make sure that you always have adequate supply of vaccines on hand for yourself.
And no power outage.
And no power outages. There you go. But thank you.
Councilor Riley.
Welcome.
So go ahead, you got,
Okay, I'll be
getting
quick.
a little late, so maybe we'll wrap it up with Councilor Riley.
Okay. So you said before that a portion of people sign up on vans and then the rest of the population comes in and I'm assuming you check that they meet the criteria and then you let them get the vaccine. So what happens if, like in Enfield, if they come from Massachusetts and they may still meet the criteria, but they're from Massachusetts? Are we turning those people away? Or how does that work?
If they live in Massachusetts, but they work in Connecticut, and their job puts them in an eligible category, then we can vaccinate them.
Okay. And then my other question is, are there specific people with health conditions or allergies or things like that who should not be getting the vaccine? Like I know they ask, if you are allergic to eggs, don't get the flu shot, is...
There are questions, and I'm not a nurse, so I do know that there's been a few people held up or turned away because of past serious reactions to a vaccine. I know some of the questions that get filled out on the consent form are, are you on chemotherapy? Are you on a long, like, corticosteroids and things like that? That doesn't automatically mean they cannot get it, but our nurse manager, who's coordinating the, vaccination station efforts, if anybody has special concerns, she pulls them out of line and talks with them. And most of them can get it. There's been maybe only 3 people who medically could not receive the vaccine. Sometimes they can't receive it because they're having another procedure or they're going to start chemotherapy, and they can get it, they just can't get it that day. So I'm just very thankful we have the nurse manager we have, because she's on the phone with their physicians and she's getting kind of their schedule of their regimen and their procedures, and with the doctor they're working out when the person can get vaccinated, because of course they're very vulnerable.
Right.
And so we want them to get vaccinated. And so that's all on the consent form, and she has training for the vaccinators, and so I think that's going really well.
Cool. And then my last question is, since as the health district, you are vaccinating with the Moderna vaccine, if somebody is dead set and they want the Pfizer vaccine, can they look on vans and find out what places are distributing that? Or can you tell people where to go that, okay, this place has the Pfizer vaccine? Is that something that's even a possibility to be able to do or not?
When we know, we tell them, and we connect with our hospital partners. So originally it was kind of, the hospital mainly had Pfizer and health departments mainly had Moderna. So if someone had a concern like that, we would take their information. I have people on my speed texting, and I would, as soon as we would get an answer, we would let them know. And if they needed the Pfizer, we would say to the hospital, so if they just make an appointment in VAMS, are they going to get what you have more of that day, or is there a way to do that? Or we send them back to their own private provider to kind of connect some of those dots for them.
Gotcha. Well, thanks, Patrice, for all you do. I appreciate it.
No, thanks all of you. My encouragement stays from all the
2
town
questions
partners.
left.
Yes.
Councilor Mangini, you had a question? Yeah, you're on
Thank
mute.
you. Yes. Am I okay?
Go right ahead.
Okay, thank you. Thank you, Patrice, for all your hard work and that of your staff. The question I have has to do with testing. I'm getting different information on when you're out of state and you return to Connecticut. Is it the 72-hour test? Is it a 10-day wait period? I guess I'm a little confused by the new rules. Have they changed in the past couple months? Can you please clarify?
I'll try to do that from memory, Cindy, but sometimes things change, and if I don't read them, I don't want to be inaccurate. So I know I have your contact information. If I'm not 100% sure, we'll reach out to you tomorrow. So people are supposed to self-quarantine after traveling out of state unless it's New York, New Jersey, or Rhode Island. They're supposed to quarantine when they come home. For now, it's recommended to be 10 days, unless you can come home, and I believe that they want a negative test result. Shouldn't be a rapid test if you're not symptomatic or anybody's not symptomatic. And the piece I can't recall is if you can get tested before you come back. But I think it's within 3 days of coming back. If you get tested and the result is negative, that you're all set. But a rapid test isn't really recommended for someone that's asymptomatic and hasn't had a known exposure, because it's not going to give us a true picture of what's going on.
No, I appreciate that, because again, I did the 3-day the last time I went away and it worked out fine.
Good.
We have to email the results, to the health department, and you are the health department.
Mm-hmm.
So I just wanted to clarify that it was no change in that area.
I've heard that things might be changing a little bit, but that would be we think that there's going to make a change because now they have stated that anyone who's 14 days past their second vaccination, if they're exposed, they do not need to self-quarantine. So that's real progress. That starts opening up the world a little bit. For 90 days after that, 2 weeks after the second dose, they have enough data now to know that as long as the person's asymptomatic, that they don't have to self-quarantine. So that starts to keep folks in the workplace if they're supposed to be in the workplace. And hopefully as they gather more data, that'll be extended even more. And hopefully it'll affect the travel advisory so I can go see my son who lives in Florida.
Thank you so much.
So closing question, I think would be helpful for people to understand. So say say there's 1,000 doses of vaccine that gets, the state or the federal government says the North Central Health District is going to get 1,000 doses. Who determines whether it goes to a provider, whether it goes to CVS or Walgreens or Walmart or whoever, whether it goes to the North Health Central, to your district, or it goes to a hospital? So who, have to be honest, I think that's what's confusing. And I think that's part of the reason why people are getting a little bit frustrated, that they don't know who is actually the puppet master when it comes to who's getting what vaccine and why. So is there a negotiation that goes on? So just like if you can answer that question so people have an understanding, like, listen, the reason why we can't do more clinics, well, you need a supply to be able to do more clinics.
Right.
And I know the rollout to some of the pharmacies were supposed to be quicker. It's taken time.
Yep.
And I understand Walmart is coming online and some others, but I just think if we could, why would a provider get one as opposed to the Central Health District compared to one of the pharmacies? So if people have an idea that, again, we're downstream, so to speak.
Right.
And we're working to get more upstream, but kind of knowing who is the one, kind of who gets what.
So that's the $1 million question. We kind of thought initially it seemed that, like the care partners, the pharmacies were going to be preference, but then when it rolled out in the pharmacies, they didn't have preference. It made sense to all of us that, say, CVS was doing the long-term care facilities, that they would get whatever they needed to do that. That made sense. We also thought the hospitals would be major players, and yet we heard a couple of weeks ago about ECHN going on a pause because they didn't get enough vaccine to fill their clinics.
Same thing, right.
And so the only thing I know for sure is that I am not in charge of doing that.
Right.
And you know what? I mean, this is good because I can ratchet that question up the line and I can say that it came from my biggest town council.
I think it's important for people to understand that, right, we're trying to get, I agree with you. I think it's just because, VAMS is confusing, and I have to admit personally, and it's just me, it kills me when we're always worried about, okay, it has to be someone from a town first. I mean, we're a border town, I hate to say it, when someone wants to come down from Massachusetts, I'm okay with that. Maybe I'm in the minority, but I'm okay with that, right? I mean, they're an American just like we are. And so I agree with you. We got to get to that point where, again, there's the supply. People understand who is controlling the supply, because that's what this is about. The demand,
Right.
to your point,
Right.
the demand is there.
Right.
The supply, I mean, go back to your basic economics 101. You don't have the supply, the demand, starts getting restless.
Right.
Yeah.
I can't see any pattern in it. I know that they say they don't want people to have slack, so they only want you to order what you can distribute in 7 days.
Right.
So that's what I did initially. All my colleagues ordered like 3 times what they can distribute in a week, and I'm like, well, I'm
Then
going
you
to.
worry about contamination, correct? If you
Well,
have-
now that we have to keep it in freezers, so that changed. First, we could use low temp
Right.
refrigerators. And I'll tell you, if you see it, they have data loggers on them, double data loggers, okay? They text me in the middle of the night if the temperature changes by a degree. So fun. But then it was switched to freezers. And so now the Moderna lasts longer in freezers, but now then we have a different step on the other side, having to do an adequate defrost of it. I'm really not clear how they're making distribution decisions because ECHM was putting out a
Is it
lot.
the federal level, correct? I want to be clear, is it?
No, I'm talking in the state. Once it gets to
But the federal, right,
Connecticut.
Isn't a federal state to state here,
Yes.
right? So, I mean, it starts at the federal level.
Yes.
Right, okay, yeah.
And then when it goes to Connecticut, Connecticut makes those decisions, and nothing that's happening seems really obvious about what's really going on. And, maybe some of it is that them just sorting out themselves
Right.
what's working, and it depends what kind of vaccine they have as well. And I think an awful lot of this goes away once we have an adequate source of vaccine. We could get all the numbers, and there's other care providers, and we have a megapod, then everybody can breathe a sigh of relief and just get moving forward.
Well, I'll just say I was over there Thursday. We thought it was a very good, clinic at the senior center. Your staff was great. I met Max and a few other your folks, and so we're getting there. I mean, I understand patience is virtue. So, but again, I agree with you. You have to be smart with this. I mean, as much as we want to be able to, it's a rapid test, but a rapid vaccine, it doesn't work the same way.
Right.
You know what I mean? And
Right.
so, again, I just think once there's a little more clarity, and I don't know where that comes from on how these are being distributed, I think that's the key for folks who are getting anxious.
Right. I will ask that question. I mean, I think that's a good question. And as far as moving maybe at a moderate pace, I'll just say that I feel an extraordinary amount of responsibility to not make any mistakes.
I agree. Yeah.
I mean, we don't want to do anything wrong. We haven't wasted a single dose, not a single dose, even though we get surprised by extra doses in vials. And that's thanks to all of our towns having their little, they'll call people who are eligible for us. But it's an extraordinary responsibility to do right.
We're now a healthcare provider. I mean, imagine this a year ago, that the town of Enfield through the North Central Health District, apologizing again, my English isn't my strength, that we now, that's what I felt when I was there. I was like, man, we're now in another, the town now is involved in something with the health district that
Yep.
we would have probably never even thought we ever would do. So you're right, things are evolving, and I just think, I also think caution's a good thing right now until we get all this figured out.
Yeah.
That's just me.
Yeah.
So, but anyways, you guys are a great partner. Yeah, of course, I've gotten to know you personally. I was expecting you to wear the Enfield shirt tonight, by the way.
Listen, I'm clean and the required parts are covered. That's all I have.
Closing, in closing, again, you're welcome here anytime.
Thank you.
So you just have to let Chris know, and we'll certainly make time for you. But anything in closing?
Just that we're only able to do this with the support of all of our town partners. And really, Enfield's been great. People pick up the phone anytime, day or night, weekend. What do you need? What can we help you sort out? And really having fun with the Enfield Police, trying to coordinate the appointments, and then they get canceled and then set them up again. Your library folks, your senior center folks. I mean, everybody has
Also
been
mentioned,
great.
sorry, how you've worked with our local, I mean, this has been tough. You mentioned the businesses, but you folks have changed a little bit, from the past to how maybe you would handle things. I really think you've tried to make an effort to be much more flexible as you can within the guidelines with our businesses, which obviously right now, to your point, these folks aren't making money.
Right.
Our economy turns pretty quickly. And I think your department has done a very good job,
Yeah.
certainly changing on the fly, in my opinion.
Oh, well, thank you. We keep trying. So I'll get answers to the questions I didn't have, and just thank you, everybody, for the continued support.
Thanks for coming. We appreciate it.
Yeah, my pleasure.
All right, folks, I'm going to give you, I know we're late, so we apologize. We'll give you 2 minutes. We'll start at 7:20. Quick break if anyone's got and we'll get started in 2 minutes.
Nice to meet you. But, you know, I have some.
Good evening, everyone. Apologize for the delay. We had a very good meeting that ran a little late. Today is the regular meeting of the Enfield Town Council, Tuesday, February 16th, 2001. Prayer by myself, if everyone could rise. You know, recognizing that February is Black History Month, and we just had the health director here, and understanding many people have, suffered, whether it be COVID related or non-COVID related. Unfortunately, may have lost a loved one, may have seen a loved one suffer over the last year. I offer a prayer for another's healing by Joyce Rupp. May you desire to be healed. May what is wounded in your life be restored to good health. May you be receptive to the ways in which healing needs to happen. May you take good care of yourself. May you extend compassion to all that's hurt. May you extend compassion to all that hurts within your body, your mind, and your spirit. May you be aware of the wonders of your mind, your spirit, and your body, and their ability in returning you to good health. May you be open to receive from those who extend kindness, care, and compassion to you. May you rest peacefully under the sheltering wings of divine love, trusting in the graciousness of presence. May you find little moments of beauty and joy to sustain you. May you all keep hope in your heart. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. God bless America. Welcome, Sheila. Roll call, please.
Mayor Ludwig.
Here.
Councilor Mangini.
Here.
Councilor Muller.
Here.
Councilor Riley.
Here.
Councilor Saraza.
Here.
Deputy Mayor Suzak.
Here.
Councilor Ungary.
Here.
Councilor Bosco.
Here.
Councilor Sakala.
Here.
Councilor Casati.
Here.
Councilor Hemler.
Here.
11 members present, none absent.
Thank you, Sheila. Move on to item 4, the fire evacuation announcement. In case of a fire, we do have exit doors in the back of the building. Please exit orderly left or right. We also have doors to our left, to folks' right. Go through those doors. Go orderly down the first doors in the hallway, down the stairs and out in the parking lot in case of a fire. Moving on to item 5, minutes of preceding meetings. The special meeting of January 19, 2021. Do I have a motion to approve?
So moved.
By Councilor
Second.
Muller, seconded by Councilor Mangini. Is there any additions, deletions, corrections? Hearing none by show of hands, all those in favor? Opposed, abstentions? Sheila, 11 in favor, 0 against. Moving over to the regular meeting of January 19, 2021, do I have a motion to approve?
So moved.
So moved.
By Councilor Mangini, seconded by Councilor Muller. Is there any additions, deletions, or corrections? Deputy Mayor Suzak?
Yeah, on page 6, the date of the appointments for Virginia Higley and for Frank Alimo, that should be 12/31/21. That was what was in the agenda, and I assume it would carry over into the minutes. And then on page 9, a couple of the motions, 5667, 5668, and 5670, we need to say, I believe they were all 11-0 for their approval. And that's all I have. Thank you.
So Sheila, do you want to wait to next meeting, or do you have them noted?
I noted them.
So we can approve as amended. Any questions on the amendment, or on the additions, or, the correction, excuse me? Hearing none, show of hands. All those in favor of the minutes as corrected by show of hands. Favor approved the extensions. 11 in favor, Sheila, 0 against. Motion approves. Item 6, special guests, we have none. Moving over to item 7, public communication. Would anyone like to speak before the council at this time? Hearing none, we declare public communications closed. We move over into item 8, council communications. Is there any councilor who would like to have a communication at this point? Councilor Crissati?
Yeah, good evening. I just would like to just mention a couple of things. First of all, I would like to recognize the Enfield Food Shelf in which their staff denied an attempted donation of food from the Proud Boys organization, that is extremist organization. And, they stated that the group didn't align with the charity's values. So I really give them, Kathy Savigny and Enfield Food Shelf staff should be commended for their stand, sticking to their values. And then the second thing I just want to mention is later tonight we're going to be voting on a resolution condemning the unlawful attack and insurrection that occurred January 6th by the said insurgents. And this resolution also has another twist to it, and that it promotes the state and federal law enforcement officers and our Enfield Police Department in protecting our community. I know that this amendment, this resolution was amended. We had good communication amongst the council, or I had communication with members of the council in regard to this. And I hope that all of us come together tonight to show our residents that we have, conviction, conscience, and courage to support this resolution. And that's all I have to say. Okay, thank you.
Anyone else? Hearing none, council communications are closed. Moving on to the town manager report. Oh, I'm sorry, Councilor, still item 8?
Okay. I'd like to make a motion to suspend the rules and move items B1, B4, E, F, G, H, I, J, and K to miscellaneous and proceed to vote.
Motion made. Second by Councilor Muller. Any discussion on the motion? Hearing none by show of hands, all those in favor of moving to miscellaneous? Those opposed, abstentions, 11 in favor, Sheila, 0 against. All set? Don, all set? Okay, council communication closed. We move on to item 9. Sorry, town manager report.
Good evening, Mr. Mayor, members of the council. I would like to, and the mayor previously, welcome Sheila Bailey, our new town clerk. She's off to a good beginning. She's done a good roll call in 2 meetings, so we wish her the best of luck. And I'd just like to say that she was really a shining candidate in the process. She was above and beyond all others, and we had some very good candidates. So I'm very, very happy that we were able to have her come to our town. She previously had worked in the town of Ellington, which is a smaller community. She then, for a number of years, went to East Granby, which was somewhat larger. And she just has left after a number of years Tolland, which I'm glad to say is a larger community, not as large as Enfield, but it's a council mayor form of government, so she has good experience in these types of meetings. So we wanted to welcome her and wish her all the luck in the world going forward. I'll just state as well, we have been working on, and we continue working on our town budget. We'll be circulating and disseminating tomorrow after my staff meeting a proposed schedule of meetings for the council. Basically, it will list, as we traditionally do, when I will introduce the budget to the town, and then we will have a number of workshops where we bring the larger departments together to explain their requests in the budget, and then a number of dates for deliberation for the council. Going to try to condense a little bit in April. Do a combination of the Saturdays and then leave for some evenings during which we can discuss deliberations, and hopefully move it up from, we sometimes go right to the wire May 17th, and we probably could do it a little sooner and move on. We have a very full agenda with building consolidation, which I'll tell you we're keeping track of. It's on track. Remember, we had a very aggressive one-year schedule, and so far we are on track. We meet weekly. And there are a lot of challenges, but staff is doing an incredible job. I also just want to preview that we are also going to probably be requesting in the March meeting to put on a discussion, because I don't want to wait again to the budget or after, about if we are going to choose to do referendums in the fall. Many communities are. There are very favorable rates today. CCM in the state is recommending that we do. So we have a couple that we had deferred from last year, and I'd like to do that actually sooner than later, so we sort of know even before the budget. Is that something that we want staff to work on, because they're very busy, and we don't want them to start down the road referendum down the road if we're not going to proceed in the fall. So I think that that's positive. There was talk today, and we have received information from our state legislators and our congressman about potential funds that Enfield might receive under the Federal Stimulus Act. It isn't over till it's over. I said we don't count our chickens till they're hatched in Enfield, and we'll see what happens. We're going to proceed on the same course we always do. We're going to be conservative. We're going to be fiscally responsible to our taxpayers. If there's a benefit and there are funds available that we can use to spur the local economy and invest in our community for the future, all to the good, but we're not going to rely on that. Hopefully we'll know before you have to start to deliberate, and it may affect probably not our main budget, because we don't want to rely on funding on our operating budget, but if there is money available for worthy public safety, public works, recreational, fields, and that money is available, that's an investment in the future that will return dividends for decades to come. So we'll keep you apprised. It will ultimately be a council decision, and there's, until it's over, said and done, we don't know what that amount will be. The education department, they've received some funds already. They may also receive funds under this. The state transportation may receive separate funds. So we'll just have to see how it all plays out. But we're not going to spend money we don't have. We're not going to rely on it. But as you know, it would be welcome. The last few years have been very tight in regard to budgets, and it would be a welcome relief if we were able to have some stimulus money to use to offset the effect of COVID and also invest in our community and the quality of life for our residents. So we look forward to that, and we're hopeful. Lastly, in our special meeting, and we'll put it up tomorrow for our residents to watch, our 6 to 7 special meeting, we had as a guest Patrice Sulik, our Director of North Central Health. I think she did a beautiful job in explaining where we've been and where we are and where she hopes us to be going, in what direction, both in testing, answered some wonderful questions of council to explain about the vaccine, how we get it, how we administer it. Kosh is going to give a report under my report next, just about the very successful joint effort we had at the senior center. And I'll just tell you two things that I think are very important for our residents to understand. One, I think she answered more clearly and concisely the question about what this vaccine really is and how it's different than previous ones than any expert I've seen on television. And that was the fact that it's when you receive the vaccination, it's not a live flu. It's not a dead flu. It's a messenger, and it convinces your body that you've already had it, and it protects you against it. I thought that was the most concise description of it that I've heard from the CDC directors to the national health people. It just really, to me, was so simple and really sent the message home. And two, I think she's been doing a good job. As I said, she has 8 towns in her district, and we're the largest, and she gives us I think a proportional amount of her attention, but she does try to be fair. And I'll tell you one thing that was unique, and she had mentioned the clinic we did was a hybrid. So we had basically 5 or 6 hours. We wanted to start off with a manageable amount. We figured we could do 150 people. And basically they said, look, we're going to give you half the slots, and then half the slots will be opened up. People can sign up from Enfield and in adjoining towns under the VAM system. That's the automated management system for vaccines. But she allowed us to sign up those eligible in the community, and our social service people who have a great program that we implemented a couple weeks ago to reach out to seniors to train them on VAMs and help them to register. So we had a list, and we had others through the Commission on Aging and their volunteers. So we reached out, and we were able to do half of the residents that were seniors from our town. So I think that's a really nice way to do it. We're going to look to use that as the template going forward, because I think it's fair. As the mayor said, we're all in this together, whether you're from Enfield or Suffield or Summers or even Massachusetts. And I think as more vaccine becomes available, people will be more comfortable. We're seeing people understanding, as Councilor Bosco had some very good questions about the side effects and the implications of it. I think she answered those well. And I think people, as it's rolled out and many more millions of Americans are receiving it, have a better comfort level about coming in and receiving it, especially if you can do it in a senior center in your town that you love and you're comfortable going to. I will tell you that we've been working very diligently for several weeks on calls every week with not only this effort we did with the health department, but collaboratively with the state, other providers, and the Department of Health Services. So what Patrice indicated is that hopefully they will have, coming forward to this more vaccine, you'll have health departments doing certain groups of the community, probably albeit smaller like we did, but also larger, and I think the word she used was megapods, more permanent locations that can do more people. So we've been working very, very hard to that end, and we are a regional center in North Connecticut, Enfield. So we're in a very good position. I will tell you, Kash is going to talk about the resources that we help provide for that clinic, and they were measurable, they were significant, and that's why we got so many emails from our residents saying, wow, that was incredible. They've gone to other clinics with friends and family member, and ours was quick and comfortable, and people went through and there were no glitches. But I will tell you that probably within a few days or early next week, I'm hopeful that I will have an announcement to make about a collaboration with other providers that will bring vaccine and much needed staff and resources to the town. As I say, we work very hard with many partners to bring Enfield the services and resources that our residents want and actually deserve. So we'll have more on that. Kash is going to report on two things. One will be the senior center clinic, and two, our garden plot initiatives, and I leave it to her in which order she wants to take them. Kasha?
Thank you, Chris. Good evening, Council. I'll start with the Senior Center vaccine clinic, since Chris provided a great introduction. So this past Thursday, February 11th, we partnered with the North Central Health District Health Department to do the vaccination clinic at the Senior Center. 152 eligible adults received their first dose of the COVID-19 vaccine. As they were leaving, they made an appointment for their second dose, that also which will be at the Senior Center exactly a month after. So, especially we'd like to recognize our staff, especially at the Senior Center, the Department of Social Services, the Department of Public Works, custodial, police department, and EMS who are present to ensure that those registered and receiving their vaccine were able to quickly receive their vaccine, and they were safely monitored, and they were able to go on their way. And I was there personally all day, and it was just an extremely positive experience. Those who came through the clinic left notes or voicemails, expressing their gratitude for how efficiently the clinic was run. Even the few people who showed up without an appointment were social services talked with them, and they left happy. So it was really a very, very good experience. We were all very happy to help the local community. Again, thank you to Patrice, Tulloch, the health department, all of our staff. Making this such a huge success. So for my second point, I just want to quickly talk about community gardens. So as you all know, the town has a very successful community garden program. This past fall, thanks to the council, $75,000 was appropriated for 3 new locations throughout town, which doubles the amount of gardens that we have. So the 3 new gardens are currently either the plans are starting to be constructed at Lafayette Park, New Manor Park, and Memorial Park. And this is in addition to our existing 3 gardens at Main Street, at Chapel Street, and at the Enfield Central Library. So in total, this spring we're going to have 210 garden plots available. Next week, with the help of Nelson Teresa, we've been talking to CMCT, and we will be launching a crowdfunding campaign in partnership with their community match program to do a walking path at Green Manor. The goal of this campaign will be to raise $15,000, which will go towards covering the costs associated with purchasing the materials needed to reconstruct the walking path there. And that walking path goes from the parking lot at Green Manor to Webster Street. And the installation will be done by our Department of Public Works. And in addition, what is really great about this is that our Public Works Department will be constructing a few accessible community garden beds so that residents of all abilities will be able to enjoy community garden plots this summer. And just as a reminder, Sustainable CT matches donations dollar for dollar. So any donations made are going to be matched. And I'd like to take this opportunity to thank, we already have a few corporate donors who are very generous with Stanley Enterprises, Kelly Fredette Lumber, Stop and Shop, and Gilbane Construction have already donated, and we really are very grateful and so happy to have such generous business partners in our community. So if anyone would like to sign up for a plot of land in any of the 6 locations, please contact Development Services. As a reminder, the rental fee is only $25 for each raised garden bed, and that includes pools and seeds and compost water, includes everything. And on top of that, this year, those who will sign up are going to be eligible for a drawing on of a Stop and Shop gift card on Planting Day, which will be sometime in June. Date will be announced. So Stop and Shop donated 10 gift cards of $100 each, so we'll be able to have a drawing for those at the time. Again, this is a great program, and the council really has put so much effort into it, and we appreciate it so much. And this walking path that this crowdfunding campaign is for is really just to make it that garden especially even more accessible and really connect the neighborhood so it would be walkable. With Chris, with that, I'm going to turn it back over to you, and thank you very much.
Thank you, Kasha. And with that, I'm open to questions, Mr. Mayor.
Councilor Riley.
I was just wondering when we might have another water pollution control meeting?
We can look. We didn't really have anything for action by the council.
Yeah.
I will tell you that we're looking at water pollution control very carefully this year. The Novak report indicated that we should be adding some employees for maintenance with the newly renovated plant. I will tell you we're hopeful to have a grand opening in June to have a ribbon cutting. It's a $43 million upgrade. It really is important for the town, gives us great capability and expansion for businesses. And so as we get closer, we're looking at some interesting ways to fund that and to look at it to have the least amount of impact on our taxpayers. I will just say it's difficult for us. It's difficult to explain. Last year, we had no tax increase. We didn't raise the mill rate, and yet people were affected by the increase that we had to have at water pollution control to be consistent with what the consultants have recommended that we need for the operating costs, because it hadn't been funded properly for many years. So even though we did a great job in not raising your municipal taxes, there was an increase in sewer usage. So this year, and I'll just forecast, I can't make any promises, but we're trying to be innovative. We don't know what that new federal stimulus money will be available for, but when the appropriate time is, hopefully we'll have some good discussion at the next scheduled water pollution control meeting, and we can schedule that probably sometime in March. And I'll remind everybody, as I said at our previous meeting, the Department of Transportation will be here at our second meeting in March 15th, to present the final plan and design for the Enfield train platform. So we're really moving along, and I'm hopeful with this transportation money and announcements. We follow very carefully the new Secretary of Transportation and what they're talking about for rail and infrastructure for the states. I'm more confident than ever that not only do we have design money available and engineering money, but they'll actually soon hopefully have the money available to build it. And again, because we didn't rest and the council didn't rest even during the pandemic, we're right at the front of that line. We're right at the front of that ticket booth. So hopefully when funds are available, we're going to be ready to go. So thank you.
Thank you.
Anyone else have any questions for the town manager? Thank you, and Kasha. Moving on to item 10, town attorney report.
Yes, Mr. Mayor and members of the council, briefly, last week, Maria Elsden and I, along with Lori Witten and Assistant Town Planner Jennifer, conducted 2 land use workshops for the volunteers who serve on our land use boards. On Monday, we did a workshop with the entirety of the ZBA regarding legal developments on 2 topics, non-conforming uses and the abandonment doctrine. And on Wednesday, we did a modified version of that presentation workshop with the chairs of the Planning and Zoning Commission, the ZBA, and the Inland Wetlands Commission. And it was well received. What we're trying to do is make sure that the volunteers who serve on those land use boards have the tools they need to discharge their duties. And to that end, there's a seminar coming up it's March 6th, which is a Saturday, sponsored by the Connecticut Bar Association, put on by land use professionals, lawyers, for a nominal cost. And despite the fact that it's a Saturday and it's a full day event, I think 9 of the land use volunteers have signed up for that Saturday event, along with some staff. And so these are, again, just steps we're taking to ensure that the land use volunteers have the tools they need to discharge their duties. As you heard, we have a lot of projects on the books, and so they'll be well equipped to do that. And that's all I have, unless there are any questions.
Any questions for the town attorney? Thank you, sir. Any reports of any special committees of the Deputy Mayor Suzak? We're on item 11, sorry.
Okay. Well, Chris, you'll get your wish. Facilities is asked to be on the agenda to bring forward the roofing referendum, which will be 13.5 million with a possible about 6 million reimbursed by the state. And it's a blend of schools and town buildings. We also listened to what Jeff had to say about windows. It does require a referendum. It's something that we had not considered for this fall, but that would be up to, what gets brought to the council. That's an $8 million. There is some reimbursement from the state for the cost of the windows, but it's sort of a Pandora's box of estimating the costs because of remediation that needs to be done with window replacement. So with that, and I think everybody was pleased at facilities with the support of the council and the things that are moving forward. So thank you, and if there's any other ways you'd like us to spend money, just give us a call.
Councilor Ungary.
I just want to say I took a tour of JFK this past week, and they're doing a bang-up job. The Blue Wing is pretty much completed, and it looks great. So they're moving along.
Councilor Sakala, I'm sorry.
Thank you. Along with what Lori said, I'm on the JFK, I'm a liaison for the JFK committee, and we were able to take a tour. And I think I reported on this a couple of weeks ago that the students should be able to move into Blue Wing on Thursday, which is wonderful. So those students who are in temporary classrooms in the White Wing and in White Wing will be moving into Blue Wing, and they will be starting work on White Wing. So it's moving along, and it really is beautiful. If you haven't seen it, go online, and you'll see a bunch of pictures all over Facebook.
Thank you. Councilor Crisati, then Councilor Bosco.
Just a couple of things in regard to
The Enfield Cultural Arts Commission. This month was Black History Month, and the commission, they have a website and a link to the program, which is called The Roots of Black Music in America. And it's going to be still on the site through the month of February. So I recommend, to the townspeople to take a look at it. It does a 100-year journey of the music. Also, the commission is sponsoring these mini concerts, virtual mini concerts, and I know that there was one held Valentine's Day. There's a couple of more that are coming up. There's an Irish Celtic group going to be performing virtually. I believe it's called Abbott's Cross. And then there's an electric violinist in the month of April, Karen Lynn. I just am amazed with this particular group and the things that they have to offer. And also in discussions right now is the partnership with the commission and the public schools with the music and many concerts that, with the department heads. And actually, they're in discussion right now on possible drawing of murals on town buildings. So I think, that's something that will be, worthwhile, as time goes on. But there's a lot of different programs that are offered. And the last thing that I just want to mention, the Commission on Aging met, and there's a group within the Commission on Aging, the Triad Group, which is with Marlene Holinsky. So she has been mentioning that she's been getting a positive response from the police department and from the EMTs with the files of life cards that are distributed to people. So if there's an emergency and they go to the house and you got these cards that are on people's refrigerators posted up there with all the information about the person, whether they have some sort of existing condition, insurance information, all sorts of information, but she'd be getting a lot of positive response for that. And I know that they're going to be out purchasing like another 1,000 cards in this upcoming budget to be distributed to residents, which is, we talk about the work that the commission's been doing with helping with the social service department and registering people with the vaccines. So, hats off to them. And I know that was the last thing that I was going to say, but also the Blight Committee did meet also, and I know I'm on with, Kelly's on that. And we discussed the property and we made a recommendation that's going to be voted on later tonight also. So that's it.
Councilor Bosco.
Well, the DPW committee is supposed to meet not this Wednesday, but next Wednesday. Hopefully we can button up this trash ordinance and get it back to the council. It just happened to be, just like a lot of things, Enfield was one step ahead of a lot of other places. There was an article in the Journal-Inquirer. I was hoping to have the article here. I tried saving it in my phone and I erased it, but it's telling you what the Journal-Inquirer did a very good article about what our cost of trash could go to, and I believe it was like $180 a ton.
$185 a ton.
$185 a ton. So just to go show the importance of trying to get a recycling program, education, and that one trash barrel. What's going to happen is we're going to make that final discussion. Staff will be able to get it. There may be a couple different ways of doing this, and it's very, very, very important because, again, when they close down them trash energy plants, there's no place for this trash. And we do have a lot of people actually taking advantage of the trash situation in this town, and we have to get that in check. But just one step further, Joe sent me a post where someone was all pissed off in Summers because their trash just went to $314, I believe it was, a year to pick up one trash barrel. And if you wanted a second trash barrel, it was $300. So trash is very expensive. We had an argument at my shop, a little friendly argument, and one guy saying he wouldn't come to Enfield because our taxes were too high. And it just happened to be another guy there from Granby. And he goes, "What, are you crazy? Your taxes are really cheap there." He goes, "And by the way, we have to pay to get rid of our trash, and we get one trash barrel." So, this is something that's going to be necessary, and hopefully we'll take care of it where it hurts the least as possible. Thank you.
Anyone else? Thank you. Moving on to item 12, old business. On page 1, items A, 1, and 2, again, remain on the table. Items 3 through 15 on page 2, old business, remain on the table. Top page 3, item 16, old business, again, remains on the table. Appointments by the town manager, item B under old business. 1 through 12, there are no appointments from the town manager. Top of page 4, 13 through 16, appointments under old business from the town manager, there are none. Item C under old business, P&Z appointed, council approved, there are none. Item D remains on the table. Item E, do I have a motion, a resolution authorizing the town manager to sign a real estate purchase contract on behalf of the town of Enfield for the sale of 92 Post Office Road? Do I have a motion to remove from the table? By Deputy Mayor Suzak, second by Councilor Muller. All those in favor of moving from the table by show of hands? Opposed? Abstentions? Sheila is 10 in favor, 0 against. One person stepped out, so 10 in favor, 0 against. And Chris, I don't know if Nelson's on or if there's anything here.
Well, it's been before the council. It was referred to planning and zoning. We got a favorable recommendation. We had the required public hearing on it, and this is for us to sell a piece of town property. We've been very aggressive in marketing property to get parcels back on the tax rolls. This will be marketed and a home will be built. So it's that simple, but if you have
Nelson, let me read
questions,
the,
Nelson
let me
can.
read the resolution, Nelson, then you can have the floor. Okay, sorry about that. Whereas the town of Enfield owns a building lot located at 92 Post Office Road, whereas pursuant to Connecticut General Statute 8-24, the Planning and Zoning Commission at its December 1, 2000, I think there's a typo, 16 meeting, we'll have to make a change, made a favorable recommendation regarding proposed conveyance of the property. Whereas pursuant to, or maybe that's not a typo, pursuant to Connecticut General, sorry, December 1, 2016 meeting made a favorable recommendation regarding the proposed conveyance of the property. Whereas pursuant to Connecticut General Statute 7163E, the town council had a public hearing on December 5, 2016 regarding the proposed sale of this property, whereas the town listed a property for sale. Now therefore be it resolved that Christopher W. Bronson, town manager, or his designee, is authorized to sign the real estate purchase contract on behalf of the town of Enfield for the sale of 92 Post Office Road to Winbrook Homes LLC. Be it further resolved that Christopher W. Bronson, town manager, or his designee is authorized to sign all documents, including a deed, on behalf of the town of Enfield pertaining to the sale of the property to Winbrook Homes LLC, subject to review and approval by the town attorney, submitted on December 11, 2020 by the Office of Community Development. Is there a motion to approve by Councilor Muller? Second by Deputy Mayor Suzak. Sorry, Nelson, you have the floor.
Thank you, Mayor Mike. The builder is out of West Hartford. They were involved in the construction of a couple of residential developments here in town, Misty Meadows, and currently they're building some homes on Rivercliff Lane residential development at the high school. The offer came in, we countered and they accepted. They submitted a modified purchase contract. Their only conditions is them obtaining a site plan wetlands approval. And they are also submitting a well water hardship to Hazardville Water, which will need to be approved by the North Central District Health Department and the State's Department of Health. There is a concern regarding the extension of water due to the length of the water line and crossing Post Office Road. But other than that, they're ready to proceed with the purchase contract.
Any questions for Nelson? Councilor Mangini, any questions? Okay. Okay, hearing none, roll call, please, Sheila.
Mayor Ludwig.
4.
Councilor Mangini.
Abstain.
Councilor Muller.
4.
Councilor Riley.
4.
Councilor Srazza.
4.
Deputy Mayor Suzak.
4.
Councilor Ungary.
4.
Councilor Bosco.
4.
Councilor Scala.
4.
Councilor Casati.
4.
Councilor Himmler.
4.
4, that's 10, 4, 10 in favor, none against, and 1 abstention.
Thank you, Sheila. Moving on to item 13, new business. Item A, consent agenda, there is none. Item B, under new business, appointments by the town council, there are none. Item C, under new business, appointments by the town manager, there are none. Item D, under new business, appointments by the Appointments P and Z Commission appointed, council approved, again, there are none. Item 14, moving to items of discussion. Item A, consent agenda, there are none. Item B1's been moved to miscellaneous. B2, again, is just informational. Item B3, again, is informational. And item C, appoint town manager appointed, there are none. Item D, appointments P and Z Commission appointed, council approved, again, there are none. We move on to miscellaneous. Sorry, bear with me. Okay. Item B1, a vacancy, Commission on Aging. A vacancy exists due to the appointment of, Marlene Hajinsky to a regular member. The appointment, it would be good to 1/1/2024. Do I have an appointment?
Yes, Pauline Davino.
Well, nomination by Councilor Muller. Second by Councilor Sakala. Motion to close by Deputy Mayor Suzak. Second by Councilor Riley. Any discussion on, by show of hands, all those in favor of closing nominations? 11 in favor, 0 against closing nominations. Sheila, do I have any discussion on the main motion? Hearing none, roll call, please.
Mayor Ludwig.
4.
Councilor Mangini. Councilman Dean.
Pauline Divino.
Councilman Mueller.
4.
Councilman Riley.
4.
Councilman Saraza.
4.
Deputy Mayor Suzak.
Pauline Divino.
Councilman Ungary.
4.
Councilman Bosco.
4.
Councilman Sakala.
Pauline Davino.
Councilman Crissati.
4.
Councilman Hummer.
4.
That's 11 in favor and none against and no abstentions.
Thank you, Sheila. Moving on to B4, Board of Education. Do I have a nominee?
Yep, I nominate Janet Cushman.
Nomination made,
Second.
seconded by Counselor Riley. Is there a motion to close nominations? By Counselor Deputy Mayor Suzak, seconded by Counselor Muller. All those in favor of closing nominations by show of hands? Opposed, abstention? It's 11 in favor and 0 against. Sheila, closing nominations. Any discussion on the main motion? Counselor Sakala?
Thank you. So I have a couple of things to say about this appointment. We've had the opportunity to interview the candidate, although I did not see her application prior to the agenda for this evening. It's important to note that this applicant was put on the agenda and endorsed prior to anybody up here on the council interviewing her. We, as in the Democrat town council members, interviewed her on Friday, and I know that the Republican town council members did after that. I want to be clear, I am not attacking her personally. I know very little about her. Just discussing what we did, what we learned about her in her interview. She's probably a lovely person, and I appreciate anybody who wants to donate their time and energy to the town. I'm talking, and I will talk about credentials and qualifications only. Being on the Board of Education is an incredibly important position, especially now. While I understand that most people don't have the information, knowledge, education, or experience prior to going on the Board of Education, they'll develop it while becoming a member. You need to have some prior. Again, not attacking her personally, but in discussing her qualifications only, she has never, ever had a dealing with the Enfield Public School System. She has never, ever stepped foot in an Enfield Public School. She, in the 25 years she's lived here, 5 children, 0, none of them went to Enfield Public Schools. I don't actually care if you choose to homeschool, private school, Catholic school, not school, or public school your children. I'm not making an opinion on what's better than what. I'm saying, as being a member of the Board of Education, you need to understand our public school and school system. Not knowing about our curriculum, not knowing about our student makeup, our diversity, our special education programs, not knowing about our teachers, that's all concerning. She taught for a few years, but that's it, 20 or 30 years ago. I take my position as a member of this town council very seriously. I'm elected by this town to do what's right by the residents. When it comes to the Board of Education, it is extremely important. This should not be filled by someone because you didn't have anybody else, which I know is not true, by the way. This should be filled by a person who is qualified. Now, that being said, I will respect the process, but I want people to understand my position and my reservations. And I really hope this gives people food for thought and a little pause before they do what they're going to do.
Anyone else?
Yes, Mayor Mike?
On Counselor Sferrazza.
I had the opportunity last night to, for the first time, virtually meet the candidate. Never knew her before. During the interview, she expressed or told us that she's a former teacher. And the question was posed to her, what did you teach? And she taught special ed. Yes, it was many, many years ago, but she was a certified teacher. I'm not aware of any qualifications spelled out specifically to hold the Board of Education. They're subjective. And, you know, people don't have to be teachers necessarily to be on the board. But I don't think I would hold that against her, that it was a lot of years ago. And, you know, for that reason, I will be supporting her appointment. Thank you.
Thank you. Councilor Mangini?
Yes, thank you. I think Councilor Sakala summed it up on my behalf as well. I have no reason to judge or not endorse, this candidate. The fact that, I don't feel she's a good fit for our Board of Education at this time. And I want to take it one step further and say that it's important that people step forward to do volunteer roles, such as Board of Ed and Council. But Board of Ed is an extremely important position to fill. And at this juncture, I just don't feel this person is a good candidate. So I will be not supporting this person. Thank you.
Anyone else? Roll call, please, Sheila.
Mayor Ludwig.
4.
Councilor Mangini.
Abstain.
Councilor Mueller.
4.
Councilor Riley.
4.
Councilor Srazza.
4.
Deputy Mayor Suzak.
Janet Cushman.
Councilor Ungary.
4.
Councilor Bosco.
4.
Councilor Sakala.
Abstain.
Councilor Crisati.
Abstain.
Councilor Hemler.
4.
That is 8. 8 approved, 3, 8 approved, 0 against, and 3 abstentions.
Thank you, Sheila. Moving down to item E, discussion resolution, transfer of funds for the community development of $20,000. Resolved that in accordance with Chapter 6, Section 8 F of the Town Charter, the following transfer is hereby made to community development, historic grant, other professional services of $20,000 from the CLG historic grant revenue of $20,000. Certified the above funds are available as January 22nd, 2021 by our Director of Finance, John Wilcox, approved by our Town Manager, Chris Prompson.
So moved.
By Councilor Mueller,
Second.
second by Councilor Crisati. It's just, this is what we've been, he's.
Yeah, this has previously been approved, and it's to hire a consultant to assist. It's $20,000. It's just simply taking the grant money and putting it into to expend by Mr. Teresio's office.
Nelson, I know you've worked on this. Any comments? I mean, this is something you worked on for, I think, a year.
Last year, I was successful in obtaining a $20,000 grant for the Infield Historic District Commission. Today, all they have is an ordinance really to follow, and for their property owners to follow in regards to obtaining a certificate of appropriateness. For those out there who don't know what a certificate of appropriateness is when somebody comes to the commission and is looking to do a physical exterior treatment to their property within the historic district, you need to get a certificate of appropriateness from the Historic District Commission. Now, there is no manual, there aren't any design guidelines currently that exist with the commission. And as part of us becoming a certified local government, I was able to obtain a grant to help and educate the people living within the district as well as the commission with providing guidelines and a manual which will be prepared by a historic preservation consultant, which will allow the commission to basically do their job better in regards to reviewing certificate of appropriateness. And that's really for exterior surfaces, windows, doors, the roof, chimneys, landscaping, fencing. So that's going to provide everybody with more of an ability to understand what the requirements and guidelines are.
Thank you, sir. Any questions for Nelson? Hearing none, Sheila, roll call, please.
Mayor Ludwig.
4.
Councilor Mangini. 4. Councilor Mueller.
4.
Councilor Riley.
4.
Councilor Srazza.
4.
Deputy Mayor Suzak.
4.
Counselor Ungary.
4.
Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
4.
Counselor Hemler.
4.
That's 11 in favor, none against, and no abstentions.
Thank you, Sheila. Moving on to item F, under miscellaneous, discussion resolution, request to transfer funds for development services coordinator study, corridor study of $21,715. Be it resolved in accordance with Chapter 6, Section 8F of the Town Charter, the following transfers hereby made. To development services of $21,715 from non-development charges contingency account of $21,715. Certified the above stated funds are available as of February 4th, 2021 by John Wilcox, Director of Finance, approved by our Town Manager, Chris Prompson.
So moved.
By Councilor Muller, second by Councilor Riley.
Again, this was done actually in 2019. The money was approved for the corridor study with CROG, but I guess probably due to the constraints and distractions of COVID, it wasn't put into the last budget, so we're just asking that it be reallocated now. And I sent out, there has been some questions by Councilor Susak in regard to the scope of the study, and those were supplied from Lori Whitten and provided to council. She's not available this evening, she is off, but if there are any additional questions, Nelson is available, but
Any questions from anyone? Nelson, anything, Nelson? I don't know if you want to comment on anything, no?
I mean, just to sum it up, it's no longer truly a border study, it's a traffic impact study based on the Infield Square Mall. We're assessing the 15 intersections located around the Infield Square. We're assessing the market feasibility of the redevelopment potential of the square. We're going to come up with a preferred alternative, a full build out of the redevelopment scenario, and then ultimately assess the traffic impacts based on that preferred build out, and then really develop a mitigation strategy to offset the traffic impacts of the proposed development. So that's pretty much sums it up in a nutshell.
Thank you, sir. Sheila, hearing no questions, roll call, please.
Mayor Ludwig.
4.
Counselor Mangini. 4. Counselor Muller.
4.
Counselor Riley.
4.
Counselor Saraza.
4.
Deputy Mayor Suzak.
4.
Counselor Ungary.
4.
Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
4.
And Counselor Hemler.
4.
That's 11 in favor, none against, and no abstentions.
Thank you, Sheila. Item G, we'll just leave on the table, for now, so it'll stay on the table. We'll go into new business next meeting. Item H, resolution to settle pending property tax appeal, Belize Automotive Realty LP versus Town of Enfield. Resolve the Enfield Town Council does hereby authorize the town attorney, James N. Talberg, or his designee to settle the outstanding tax assessment appeal in the following action. Belize Automotive Belize Automotive Realty LP versus Town of Enfield, docket number HHB-CV-20-6061055S. The penalties assessed per the Connecticut General Statute 12-63CD for the grand list years of 2018 and 2019 are hereby repealed, prepared by the Office of Town Attorney on January 20, 2021.
So moved.
Councilor Muller,
Second.
by Deputy Mayor Suzak. Attorney Talbot, I don't know if there's anything.
There's nothing really to add. This was just an error that was assessed and that we all agree should be removed.
Any questions on this? Hearing none, roll call, please, Sheila.
Mayor Ludwig.
4.
Counselor Mangini. Counselor Muller.
4.
Counselor Riley.
4.
Counselor Saraza.
4.
Deputy Mayor Suzak.
4.
Counselor Ungary.
4.
Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
4.
Counselor Hemler.
4.
11 in favor, none against, and no abstentions.
Thank you, Sheila. Item I under miscellaneous, resolution setting a public hearing to amend Chapter 26, Article 1, Section 26-35 of the Enfield Town Code, Economic Development Commission membership, whereas the Town Council expanded the membership of the Enfield Economic Development Commission by resolution number 4184 on June 6, 2017, whereas the Connecticut General Statute 7-136 allows for total commission membership of not less than 5 nor more than 15, and whereas the commission's current membership consists of 15 members and is unable to sustain a quorum, whereas the town council would like to reduce the commission's membership to 9 members. Now therefore be it resolved, the Enfield Town Council will hold a public hearing in the Enfield Town Hall Council Chambers, 820 Enfield Street, Enfield, Connecticut, on Monday, March 1st, 2021, at 6:50 PM to allow interested residents an opportunity to express their opinion regarding the amendment of Chapter 26, Article 1, Section 26 through 35 of the Enfield Town Code, written by Lori Witten, our Director of Development Services, on February 4th, 2021.
So moved.
By Councilor Mangini, second by Councilor Muller. Pretty self-explanatory.
Yeah, it is. Quite simply, this is a public hearing which will allow the membership to be reduced from its current 15 to 9, just because over time with attrition, it's very difficult to keep a 15-member board and then have enough people to have a quorum. So this is going to just reflect reality. 5 is too little, 15 is too much, 9 is just right. This is setting a public hearing so that we'll be able to accomplish that.
Any questions? Hearing none, roll call, please, Sheila.
Mayor Ludwig.
4.
Councilor Mangini. 4. Councilor Muller.
4.
Councilor Riley.
4.
Councilor Srazza.
4.
Deputy Mayor Suzak.
4.
Councilor Ungar.
4.
Councilor Bosco.
4.
Councilor Sakala.
4.
Councilor Crissati.
4.
Councilor Hamler.
4.
11 in favor, none against, and no abstentions.
Thank you, Sheila. Moving on to item J, discussion resolution to authorize the reduction of property maintenance fines for 19 Welch Drive. Whereas the property at 19 Welch Drive was cited between 1 June 18, 2018 to January 14, 2021, and for the second time, January 23, 2019 through February 11, 2019. Whereas the cited violation 1 was for missing or boarded windows for a period of more than 90 days, and severe structural damage, cracked, broken, or missing siding. And the cited violation 2 was for persistent garbage, refuge, or trash on the property. Whereas pursuant to the Enfield Town Code, the property owners did not contest their liability for the violations before a duly appointed hearing officer. Whereas pursuant to Section 14-183 of the Enfield Town Code, property maintenance liens securing the fines were recorded to the town's land records, whereas the foreclosure sale took place on March 18, 2020. Whereas at the time of foreclosure, all evictions have been placed on hold due to the COVID-19 HUD moratorium. And whereas the property was vacated on November 20, 2020, and the bank was able to address the violations and complete all outstanding work on by January 2021. And whereas the property has been blight-free since January 14th, 2021, whereas M&T Bank have agreed to pay the property maintenance liens from the time they were able to occupy the property, which was 11/20/20, totaling $84,000. Whereas the Blight Review Committee has reviewed the requests and are recommending the lien of the property to be reduced from $63,498 to $8,400. Now therefore be it resolved, the Enfield Town Council does authorize reduction of the property maintenance liens on 19 Welch Drive, and authorizes that the amount set forth in attachment A be acceptable in lieu of a full payment of those liens, submitted on February 5th, 2021 by Casa Perciello, our Assistant Town Manager.
So moved.
Second.
By Councilor Muller, second by Councilor Mangini.
Mr. Mayor, Kasia will give an overview. She's the liaison to this Blight Review Committee, which has been extraordinarily successful in its purpose. And as you know, just as an overview, before she gives the specifics, the town has been very diligent in remediating blighted properties. And in the course of that, sometimes the fines really get up there and are quite high. The goal of blight remediation is not to bring revenue to the town, but to clean blighted properties and return them to the tax rolls. And it's been successful. The Blight Review Committee has prerogative up to $10,000. If they make a recommendation, such as they are in this case, to do more, the ordinance is quite intelligent, and it says, well, the whole council should look at that. So that's what we have before us, and there's a recommendation, and Kasia can just give you the facts of the situation. And I'll just make known, we've never, and nor do we do not waive clean and lien. In other words, this is something that accumulated by virtue of a daily fine. We didn't expend funds. In those properties that we actually have to go in and clean up and remediate, and we have a cost, we never waive that. But that is not the circumstance here. Kasia?
Thank you, Chris, and thank you for saying that. Good evening, Council, again. The resolution had a lot of information. There were two different property maintenance liens on this property, from June 2018 all the way until January of this 2021. So at the time, there's a foreclosure sale on this property in March 2020. You know, that was the beginning of the COVID pandemic. There was a moratorium on evictions. There was nothing the bank could do at that point. The bank actually, we appreciate this very much. They came to the table, having done the math, that they were able to get on the property in November of 2020, which was a total of 56 days. And that's how long it took them to clean it up between the November of 2020 date to the date it was cleaned in January of 2021. So they came to the table with that offer that was the only time they were actually able to be on the property to address the violations. And once they were able to access the property, once the people living there had vacated, they addressed them as quickly as they could. They went out to bid and got all the siding, the windows, all that fixed. So again, they will be paying $8,400, and this will allow them to convey the property to HUD. And that's all the information I have. The reduction is a total of $63,498, and the town being paid $8,400.
Thank you, Kasha. Anyone have any questions or comments? Hearing none, roll call, please, Sheila.
Mayor Ludwig.
4.
Councilor Mangini.
4.
Councilor Muller.
4.
Councilor Riley.
4.
Councilor Raza.
4.
Deputy Mayor Suzak.
4.
Councilor Ungary.
4.
Councilor Bosco.
4.
Councilor Sakala.
4.
Councilor Crisati.
4.
Councilor Hemler.
4.
That's 11 in favor, none against, and no abstentions.
Thank you, Sheila. Moving to item K, resolution condemning the attack on the Capitol. Be resolved, the Enfield Town Council condemns the unlawful attack and insurrection that occurred on January 6, 2021 on the federal Capitol by the said insurgents. Whereas the Town Council proudly proclaims that our law enforcement officers have a long and consistent history of always working in cooperation and collaborating with state and federal enforcement officers to protect the citizens of this community, whereas the Enfield Town Council and its staff continue, as they always have in the past, to assist any and all lawful requests made by the federal state agencies in their investigation into participants of this incident, whereas our law enforcement officers have diligently fulfilled and shown their commitment to carry out the solemn oath and obligation to protect and defend the Constitution, the state of Connecticut, the Constitution of the United States of America. The Enfield Town Council publicly express their support for the members of the Enfield Police Department and proclaim that they should be a source of pride for the Enfield residents. By Councilor Sakala, seconded by Councilor Crisati. Any discussion? Any discussion from anyone? Councilor Ungary.
I do want to go on record as saying that I'm not going to support this resolution. I do want to go on record by saying that I am against all violence. I support all law enforcement. We as a council, we don't need a resolution to say that. And I'm also on our public safety committee, so I support all our police. I'm wondering, why is this event singled out? Why not include all the violence that happened this past year, the riots, the looting, the burning the police cars? We recently had a resolution against Connecticut tolls. Now that affects Enfield. This does not. This is something that happened in the nation. Several times tonight, we spoke about a slippery slope, and I think this is just that. Are we going to bring up everything that happens in the country and say, oh, we need a resolution against it? This doesn't pertain to Enfield at all. I think it's purely political, and I won't support it. And I just don't see any relevance to Enfield.
Councilor Bosco.
I agree with Councilor Ungary. I don't believe of any violence, and it shouldn't have happened there, and it shouldn't have happened in Seattle, and it shouldn't have happened in Minnesota. There should be no violence at all, and I can't just go single out one thing of violence. It would have to be naming all of violence, because no violence is right. You know, there were people murdered in all the other cities, people injured, billions of dollars of damage to their buildings, and loss of life, and we're going to single out one. We should be singling out, we should be just putting everything, just a blanket statement that we do not condemn violence at all, period, done.
Councilor Mangini, then Councilor Hemler.
Thank you. I do want to agree with my fellow councilors in that no violence should be allowed or accepted, 110%. However, I am going to definitely support this resolution. It's very well crafted, by the way. And furthermore, an attack on our capital is an attack on our sacred ground. Many people, law enforcement and others, have lost their lives in this attack. And quite frankly, this resolution should have been brought forward immediately after the attack. So I definitely am going to support this, and I want to send a message to our Enfield residents, our Connecticut residents, our residents in our country and all over the world, that we will not stand for this type of insurrection. Thank you.
Councilor Hemler.
I would like to make two motions. I'd like to make two amendments. On the first paragraph, to change it to, be it resolved that the Enfield Town Council condemns all violence, period. Second amendment would be to remove paragraph 3. It's completely irrelevant. Let's stop kidding ourselves. This is a political stunt. And I think this is a serious matter. Violence, any violence, like Councilor Ungary and Councilor Bosco said, is wrong.
Two amendments made.
Second.
Second by Deputy Mayor Suzak. We'll take one amendment at a time. The first amendment, you basically added the words "all violence" after condemns, and then leaves the unlawful attack. It just adds the word "all violence."
Correct.
Any discussion on the First Amendment?
Yeah,
Councilor Peraza, then Councilor Sakala.
So could you read what the amendment would say?
Be it resolved, you want to go ahead?
Sure. Be it resolved that the Enfield Town Council condemns all violence, period.
And the unlawful attack.
No.
Oh, so you want to cross out all that?
Yeah.
Okay, you didn't say that. Condemns all violence, then the unlawful attack, all that's she wants to take out.
May I ask a question, Mayor Mike?
Well, 1 second, you got Councilor,
Okay, thank you.
Carl, Councilor Sprazza, you.
Yeah, can I go?
Yeah, go ahead.
Okay. In 1980, I took an oath to support the Constitution of the United States and the state of Connecticut. And for the next 38 years as a police officer, that's exactly what I did. I protected law, due process of law, peaceful transition of power. I never supported mob mentality. If you're not happy with an election, if you're not happy with a particular law, the Constitution provides a way to change that. It's called going through the political process. I know that's not expedient, it's not quick, but it's peaceful, and that's what this country was founded on. If we don't condemn violence at our nation's capital, then we must be tacitly approval that if it doesn't go your way and the courts don't go your way, then you take up arms. You pick up a club or a bat and you start to smash police officers' heads with it because you were right. I can't ever support that. As a police officer, I didn't support it. And in 2019, when I took an oath to be a member of this town council, I also took that oath to protect the Constitution of the state and of the United States. And that's what's prompting me to support this, because that was nothing but mob mentality. I agree with Councilman Bosco that violence of any sort, which happens every day, is not acceptable. There's no doubt about that. And if you read, and just so everybody understands, this resolution originated with Councilman Crissati. In its first draft, there was language in there that I believe went against the town charter. I discussed it with him. I wrote paragraph 2 and paragraph 4. For the people at home, let's read paragraph 2. The town council proudly proclaims that our law enforcement officers have a long and consistent history of always working in cooperation and collaboratively with our state and federal officers to protect the citizens of this community. So in 2016, when I was still chief, I received a letter from our former governor instructing all the police chiefs to turn their backs on Homeland Security officers, not to assist them. I was taken back by that. I said, we work with our federal partners every day, whether it be the FBI, Secret Service, DEA, and is it because the political winds at that time didn't want immigration enforced, we weren't going to cooperate? I took an oath to the Constitution to enforce the law, and I did it anyways because I could. Unfortunately, since I retired, the legislature in Hartford has passed a law that now limits the ability of our chief and our department to work in partnership with Homeland Security, who, by the way, in addition for illegal immigration, are rounding up dangerous gang members. And now we're prohibited in this state because of what happened in Hartford. And I find it ironic that they call upon the police, well, do it this time, but not that time. That isn't how it works. So I have to support number 2, because we've always worked in partnership with our federal partners and our state partners. Let me read the last paragraph for everybody. Whereas our law enforcement officials have diligently fulfilled and shown their commitment to carry out their solemn oath and obligation to protect and defend the Constitution of the state of Connecticut and the Constitution of the United States of America, the Enfield Town Council publicly expresses their support of the members of the Enfield Police Department and proclaim that they should be a source of pride for all Enfield residents. I'm not against, I could never vote against that because I am proud that we fulfill our oath. I will concede this much, though. I'm not really sure why the second paragraph or the third paragraph's in there. It talks about the Enfield Town Council and staff continue as they always have in the past to assist in any or all lawful requests made by the federal and state agencies in their investigation into this incident. I don't know what that's all about. But even though I don't support that third paragraph, the underlying tenet that goes through this resolution is to support law enforcement, cooperation between law enforcement, and foremost, it supports the rule of law, not mob mentality. Not, well, I lost in court, so let's get some bats and let's break some cops' heads up, right? That ain't gonna happen. And that's why I will support this, even though I agree with Councilman Bosco. I don't support any violence like that. And I really don't think the third paragraph or the second paragraph or the third one needed to be there, but nonetheless, I'll be supporting that. Thank you.
Councilor Sakala.
Thank you. As to the amendments, I don't support the amendment to paragraph 1. Councilor Hemmler, you are absolutely right. Nobody here on this dais and on this floor in this council chambers supports violence of any kind at all. And you are more than welcome to try to craft a resolution every time a violent act happens to bring it forth to this council. I implore you to do that. The third paragraph does have something to do with Enfield. So Councilor Ungary, Councilor Bosco, and Councilor Hemmler, it does have to do with the town of Enfield, as does paragraph 4. I find it disheartening that anybody would think that this is a local political stunt. This was an attack on our capital. This was an attack on our nation. This was an attack on the people who were at that capital, that were there to protect and serve them. There is absolutely nobody in this room that should be okay with that and that should have any issues saying so, and saying so loudly. So I will be supporting it as written. I do not support the amendment of taking out paragraph 3 and changing paragraph 1. Thank you.
Councilor Crisari, then Councilor Mangini.
Yes. This was brought up, it's almost a month now. I respected the process of the resolution. Councilor Speranza contacted me. We had a discussion. We added things to this amendment. It was then brought up to this council respectfully and respectfully done between us and working together as councilmen. And we came up with this resolution. Weeks have gone by. Weeks have gone by. And all of a sudden tonight, you want to change paragraph 1 and you want to change paragraph 3. Well, I don't support that. I would support as is. And I'm going to support as is for paragraph 3. And I support this resolution because I think it's very important for the townspeople to know, and for you to think that this is a political stunt on my part. Please do not flatter yourself, because it's not. And I've had this discussion with a few other members of this council in regard to that. This was a resolution that was thought of by myself, which I thought maybe leadership might have taken control of, which did not, condemning this unlawful attack and the insurrection that occurred. Period. End of report. I am not talking about anybody that might have attended the rally and was part of it. That has nothing to do with this. This was in the hope that we would come together and show the residents, and like I stated before, that you have a conscience to support what was stated over a month ago and worked upon by us, and now you want to come back and do amendments to this. Well, you know what? Maybe you should have gave me a call during the week and we could iron this out a little, or last week or the week before. I'm going to support the resolution as stated, as that was given to everybody in regard to this. Thank you.
Councilor Mangini and Deputy Mayor Suzak.
Yes, thank you. I just wanted clarification, Mayor Mike, on how the vote will proceed. I am not supporting any amendments to the initial resolution. I believe that this resolution is well crafted with all of the paragraphs, and I will vote as it stands. But I want to be very crystal clear that when we do vote, that each council person understands what he or she is actually voting on, be it the amendment resolution or pure resolution that has been presented by Councilman Crisati.
Both amendments get voted on first, and then the final, the initial resolution as if amended. So it'll be correct.
I'm not agreeing.
We'll be clear.
Okay.
We'll be clear on what we're voting on. Correct.
All right, thank you.
Yep. Deputy Mayor Suzak.
You know, the thing is that we're all, why, I understand that the attack on the Capitol is something that I don't think anybody needs to have a resolution to actually understand that we are not in favor of any of these types of actions. But the problem is that over this past year, there have been a substantial number of incidences that have occurred that there's been no ramifications to. And this is the problem when you don't draw the line in the sand with what happens first. And then we decide that we're going to pick and choose what we draw a line in the sand. And I honestly don't want to be having to sit and watch the news so that I can go home and write a resolution over it. That's not the business of this council. And it's, and I was upset at the first draft, that I felt that we're telling our police to do what they already do. I don't know why we have to do that. The town of Enfield always cooperates with everyone. So for me, I don't understand why all of a sudden we think we need resolutions telling people fundamental beliefs of this council and the fundamental things that our police do.
Councilor Bosco?
Okay, I'm going to open my mouth up again, and I'm probably making a big mistake, but I'm not going to shut up. First off, nobody tells me what to do. Mike, Cindy, anyone on this council will never tell me what to do. I'm my own person, and I'm going to make up my own mind. So leadership will never tell me what to do. Secondly, my life, your life, all this council, our senators, our firemen, our EMS, our police officers, nobody's life's any more valuable than somebody else's. And when Nancy Pelosi sat up there, and I will make this political, and she was saying, well, people will do what they got to do, and you have our vice president out there bailing people out, what do you think's going to happen? Finally, everyone else is going to be mad. There's not going to be any people with civility anymore. They should have stopped it in the beginning, but no, it was a political thing that they wanted to go their way, and they got their way. And now all them congressmen and all them people standing up there got what they needed too, because the people are finally sick of this stuff. And to say that we're going to condemn the Washington when we're not condemning Seattle, them people in Washington aren't any more important than the people in Seattle. And then by doing this resolution, that's what we're saying. You know what? Them people up at the Capitol are more important than the people at Seattle, more important than the people in Enfield, more important than the people in Minnesota. No violence. It should be no violence, as I'm getting hot. But there should be no violence. And to even mention the Capitol, you should be ashamed of it, because it should be no violence, not just one section. So I will support anything that says no violence, but if it's just the Capitol, I'm sorry, there ain't no way I could support that, because all them people that lived in the other side of the state or wherever they had these riots are hurting. They don't have houses. They can't even go buy groceries. And then we have our vice president bailing them out. So what's happening? By doing stuff like this, we're telling the other people that got hurt and lost whatever they lost, you know what, you don't matter. But oh, wait a minute now, because a cop got hurt or a fireman got hurt or we scared someone at the Congress, oh, well, now all bets are off. All violence should be stopped. And that should be it. And then from now on, the people down in Washington know what it's like. When they start to revolt somewhere else, they should be calling the cops, the National Guard, and whoever out there to go protect them. Because now they know what it's like. And I'm sure I'm going to catch a bunch of rash about this, but nobody life is more important than someone else. We all get up in the morning, we eat the same, we drink the same, and you know what? When we finally die, we got the great equalizer there on King Street that we all go to. So maybe one person has a better tombstone than someone else, but it doesn't make a difference. What matters is if we're good people, we honor the law, we respect our police officers, we respect our military, and we respect the rights of people to be able to go home and enjoy life just like it should be in the Constitution. And nobody should, you think about them poor little kids that were sitting in them ravaged cities, how scared they were when they were rioting in them towns. And we're gonna worry about Congress? What about that kid? That kid's life has changed forever, but no one cared about that kid. So by going and saying something about Washington, everyone should be ashamed of themselves. Because your life's no more important than mine. And you know what? My family thinks my life's more important than yours. All our families think our life's more important. And it's not. We're all the same. I don't care what color you are, what religion you are, we're all the same. And everyone is entitled to the same rights by the Constitution of safety and protection as anybody else. So you should be ashamed of mentioning that without mentioning the rest of the poor people there. And if you vote no, you're the ones that have the problem. Because yes, you're still condemning the violence over in Portland. So I know I'm going to get stuff, but I don't care. What's right is right. And by saying no because we took the Capitol out, you go look at that poor kid in Portland that may not have a father or a mother, and you go tell them, oh, geez, you know what? Nancy Pelosi and everybody in Washington's life's more important. I'm done with it.
Councilor Riley.
Well, I'm not so sure I can articulate that well, like Mr. Bosco just did, but I have to agree with basically everything Judge Joy just said, and I have to agree with what Donna said. Everybody should be treated equally, and I don't think that we should single out any particular act of violence. And it would be crazy to assume that nobody up here didn't condemn violence. Violence is a horrible thing, no matter how it happens, where it happens, or who it happens to. I would support the resolution anyways, because I support our police officers and the work that they do. And I don't think that what happened at the Capitol was right. And I would be in favor of supporting the resolution if we had the first paragraph say, including but not limited to the violence at the Capitol. But, I mean, if we do this, do we really need to say this whenever something happens? I mean, are we going to turn into McDonald's where people sue us because they couldn't read that the coffee in the cup is hot? I mean, where is the line? Where do we stop? But how do we still make a stand? So I'm okay if we do including but not limited to the attacks on the Capitol, because all violence and what happened at the Capitol, in Seattle, in Minnesota, anywhere, down the street, people driving into convenience stores, all of it is all wrong and should not happen, but it does. So I know where you're coming from. I know that you want to make a statement about it, and I'm cool with that, you know, but I think we need to say that all violence, no matter what, is unacceptable.
Councilor Sferrazza?
I have a comment and then a point of order. So let me do my comment first. I agree with Councilman Bosco when he says that the lives of people in Washington are no more important than the people in the cities that were burned down. You're right. When new people used to come on the police department and I swore them in, I'd give them a badge, and I used to tell them, you personally are not more important than any other citizen. You're just a citizen that is sworn to protect the law. It doesn't make you better than anybody, smarter than anybody, or stronger than anybody. The difference was the badge represented something. Symbolically, that badge represented the Constitution of the United States and law and order. When they burned down Walgreens, it's horrendous. When they ravage these cities, it's horrible. The Capitol symbolically represents everything that's American. The United States Capitol represents the foundation of this country. So it's not the politicians that are more important. It's what it represented. And when people stormed that building and smashed the windows and hurt the police, and then had the indignation to go sit at the chair where the president of the Senate sits, that representation needs to be addressed. It's not the same. It's not about the people. You're right, Joe. I agree with you. We're all the same. But what that represented, what the badge represents, these are symbolic expressions that need to be protected.
We need to respect that.
That's what I'm saying.
We need to respect
And as far as my point of order, Mr. Mayor, I'm not, I don't know if I'm correct, but I believe Councilor Hemler proposed 2 amendments. Aren't you supposed to deal with each amendment
Right, we will.
separately?
We're dealing with the first.
And then we do a
Yep,
vote on the
exactly,
second?
Right, exactly
Okay,
right.
all right, thank you.
So Counselor Riley made a suggestion on your First Amendment saying condemns all violence, including the unlawful. Is that, so she made an amendment to your First Amendment. I'm going to Counselor Hemler.
No, it's a point of order, Mayor. This amendment's already been introduced on the floor. I don't think we cannot deal with it
No, I'm
and
saying,
go to this
but
one.
she was saying so she could withdraw and then we
Oh,
could, that's what I'm
okay,
saying. I'm asking her if
okay.
she would.
To vote her amendment up or down.
She can withdraw it. So from a point of order, she can withdraw it. Right, she can amend her amendment. Right. So I mean, I know she technically can withdraw and then she can resubmit it or or she can make it, for the first time about the First Amendment from a point of order.
See, I agree with both statements.
So,
I
yeah, but you.
agree with both statements.
So,
If it's more palatable
So
with
can you
what.
withdraw your First Amendment?
Okay.
Say I withdraw my
Okay, so I'll
first.
withdraw the first.
Who was the second on her
And-
first? Council Unger, you got to withdraw your second.
No, it was.
Was that you
was
withdraw?
Donna.
So we withdraw with the First Amendment. And Councilor Riley made an amendment to that amendment, saying condemns all violence, including the leaves in the unlawful attack on the insurrection on January 6th.
No. It would be to be resolved that the Enfield Town Council condemns all violence, including but not limited to the unlawful attack on our Capitol.
Sheila, you got that?
Yes. All violence, including but not limited to.
The attack on our Capitol.
The unlawful attack.
Unlawful attack on the.
Unlawful attack.
Yep. So that was a compromise. Any comments on the First Amendment? Any further comments on the First Amendment? So again, Councilor Mangini, there's a compromise to the First Amendment. This would be a vote by hand on the First Amendment. It has nothing to do with the overall resolution. It's on the amendment itself. Did you hear what the amendment was, the change?
Yes, thank you.
Okay. Anyone else have any comments or questions? On the First Amendment, by a show of hands, who all in favor, raise your hands. We have 1, 2, 3, 4, 5, 6, 7, 8 in favor. Those opposed? 2 opposed. Cindy, I'm sorry, what? Cindy, you're opposed, 3 opposed. 8 in favor, Sheila, 2 opposed. Excuse me, I apologize, hold on, I got it, hold on. 8 in favor, 3 opposed. So the amendment passes. Amendment 1 passes. So now we go on to Amendment 2, point of order, Councilor Speraza. The Amendment 2 is to eliminate that third paragraph. Any comments or questions or concerns? First, before we get Councilor Mangini, I want to make sure I get we're talking about the Second Amendment, which is to remove the third paragraph. It's already on there. Yep. Okay, you're good? Any comments from the floor? Councilor Speraza.
Like I said before, I'm not sure it's exactly clear what it's talking about, because it's talking about town staff helping in this investigation like they have in the past. I think the spirit of this amendment or this paragraph says that just like our police follow what the law provides, I'm sure our town staff does too. And I think the whereas says that. So I would not vote this amendment down because of that, but I do understand people's maybe having a problem the way it's worded.
Right, and my personal view, I take an oath too when I serve, and I take it very seriously, and I don't need a resolution to remind me how to uphold my oath. I take it very seriously with the Constitution. I try to 24/7 live by the law, and I don't need a resolution to remind me to do that. That's my beef with this paragraph, personally. Any other comments or questions? So the amendment is to remove paragraph 3. Second amendment, this is the second amendment. Any other questions or comments? Hearing none, by show of hands, all those in favor of the second amendment? Opposed? So there are 4 opposed, 6.
We're removing it, right?
Yes.
Yeah.
7 in favor, 4 against. So the amendment passes. So now it's been amended twice. The overall resolution has amended twice. Any other further discussion?
Wait, Mike, can you do that again? Can you count that again?
Sure, I'm sorry. Fair point, Counselor Sakala. All those in favor of removing the paragraph by a show of hands? 1, 2, 3, 4, 5, 6 in favor? Are your hands up? 7 in favor. All those opposed of removing the paragraph?
That's where I was.
Sorry, Counselor Sakala, 4. So 7-4 vote. Thank you. Now, on the main motion, any further discussion? As amended. Again, we're voting on the main motion as amended.
I just want to say that I still will not be supporting this whole thing because if I can't agree with the whole thing and just parts of it, like much of it that Counselor Safraza says, I agree with. But if I can't agree with the whole thing, I'm not going to support it.
Okay.
We don't need a resolution.
Anything else? Hearing none, roll call, please, Sheila.
Mayor Ludwig.
4.
Counselor Mangini.
Against.
Counselor Muller.
4.
Counselor Riley.
4.
Counselor Esparza.
Mayor Mike, before I vote, I just want to make sure we're clear. We're voting on this resolution as amended.
Correct.
Which just says the part about, in the beginning, about not limited to.
Right.
And we've eliminated 3.
Everything else is the same.
Everything
Correct.
else is the
Correct.
same?
Yep.
Okay, then my vote is 4.
Deputy Mayor Suzak.
4.
Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
She didn't call my name.
Who did I miss? Unger? Counselor
Yes.
Unger?
Yes.
I am so sorry. Counselor Unger.
Okay, against.
I'm going to vote for this, but I'm very,
Counselor Crissati.
I'm voting for this, but I'm very disappointed in this, but I am supporting it, though.
Counselor Hemler.
4.
We have 9 in favor, 2 against, and no abstentions.
Thank you, Sheila. Moving on to item 16, public communications.
Mayor Mike, may I ask a question?
Sorry, Sam, we already moved on to public. When you can have the next, we have council communications, you're more than willing. But, welcome. I'll go to you first, Cindy. Welcome.
Okay, thank you. I just wanted to.
Cindy, sorry, public communications, then we'll go to you. I'm sorry, 1 second. Go ahead, sorry about that.
Walter Cruzel, 21 Charlie Road, also Chairman of the Board of Education. I want to first welcome our new town clerk, Sheila Bailey. Well, I've heard this meeting. You've done an excellent job so far, so welcome to Enfield, and hopefully you'll be here longer than me. So, second, I want to thank the council for making my board whole again with all 9 members. I very much appreciate that. And thirdly, I just want to thank all the members for their service to the town of Enfield. And it does mean a lot to me, so thank you all for your service to the town.
Thank you. Moving on from public communications, Cindy, item 17, counselor communications. Cindy, go right ahead, sorry.
Thank you. Just for, a comment here. I guess maybe I'm not understanding Robert's rules too well. I need to go back to the book. But I was under the belief that there were resolutions applied to the initial resolution condemning the attack on the Capitol. I was under the belief that once that was voted on, we would go to the second layer, which was the original resolution. And if that's not the case, so be it. But I want to make my position very, very, very crystal clear that the reason I would not and will not and could not vote for the resolution with those amendments is because I truly stand firm behind the original resolution. I want to make that very, very clear. Thank you.
Councilor Bosco. Yeah, on another note, seeing as we got rid of a parcel of land, I just want to make sure that we don't forget about the mitigation. I want to keep it in your mind.
Any other council communications? Yeah, again, I just want to say to all the, if anyone's had a chance to see our kids compete at the high school level, they're wearing masks and they're competing. And I can't tell you how difficult it is to see these kids breathe. It's really difficult, but they're competing. They're out there trying. And hopefully, again, by the spring, we'll be able to go out and watch our competitive sports again in any of the sport that you love and are into. But again, I want to thank all our kids in town. I know kids watch this meeting. Hope you guys hang in there. You guys are doing a great job. This has been very difficult on all of you, but we're moving forward, and hopefully, again, we'll get you back to normal and better than ever. Do I have a motion to adjourn? By Councilor Muller, second by Deputy Mayor Sulak. All those in favor? Opposed? 11 in favor, 0 against. Good night, everyone. Have a good night.